august body of the public and many, many faces who I'm sure are busy helping out in the human relations work of our city. And so we thank you up front. We're going to have a roll call.
Commissioner Brombaugh, Chair Kralik,
Present.
Commissioner Lee,
Present.
Commissioner Onan,
Here.
Commissioner Smith, Commissioner Stinger, Vice Chair Shu.
Present.
Thank you.
Okay, agenda changes, requests, and deletions. Not hearing any, we'll move on to oral communications. We have communications in the context of the CDBG grants and also the HISRAP grants. If there are other communications outside of those, we're okay to move forward with those. Does anyone have a communication outside of those? Okay, not hearing any, we'll move forward to the business of the meeting. The first is the CDBG presentation. It relates to funding requests, Community Development Block Grant. We're going to hear first from the staff, just to explain the process that they've gone through. We'll then take questions from the commission, that is the members here at the table, to the staff, and then we'll call on applicants with their oral communications. And subsequent to that, we'll have discussion and consideration, and then we'll move forward with recommendations, if any. Okay? Please introduce yourself.
Sure. Yeah. Good evening, commissioners. My name is Erin Makbul. I am the CDBG staff specialist, and with me is Marilyn Rowe. She's our CDBG consultant. We are here tonight to give you a brief overview of the fiscal year 2019-20 CDBG allocation process. A little background on the CDBG program. It is a principal federal program. The City of Palo Alto receives annual funding from the U.S. Department of Housing and Urban Development as an entitlement city under this program. Activities funded through this program must meet one of the three national objectives. Number one, benefit low and very low income persons. Number two, aid in prevention or elimination of slums or blight. And number three, meet other community needs that are particularly urgent for the low income community. All of the activities funded by the city meet the first objective. So CDBG federal appropriations for fiscal year 19-20 have not yet been determined. For budgeting purposes, city staff has estimated the city's HUD entitlement grant of fiscal year 19-20 based on a 10% reduction in funds from fiscal year 2018 and 19. The estimated CDBG entitlement amount is 436,335, which is a 10% reduction of the current CDBG entitlement grant of 484,816. The total estimated funding available for allocation in fiscal year 2019-20 is 661,045, which consists of estimated entitlement grant of 436,335, estimated program income of 136,049, and 88,661 in prior year resources. CDBG has 5 funding categories in which to allocate funds. Number 1, public services. Number 2, planning and administration. 3, economic development. Number 4, housing rehab. And number 5, public facilities. According to federal regulations, there is a maximum spending cap on public services and planning and administration. Public services have a maximum spending cap of 15% of the entitlement grant and 15% of actual program income received during the previous fiscal year. Therefore, the maximum that can be allocated for public services for fiscal year 19-20 is 80874. The agencies that have applied for funding under this category are Palo Alto Housing Corp., Catholic Charities, Life Moves, YWCA, and Silicon Valley Independent Living. Planning and administration, which includes the administrative costs associated with managing the CDBG program, has a 20% spending cap placed on the entitlement grant and the estimated program income. Therefore, the maximum that can be allocated for planning and administration in fiscal year 19-20 is 114,476. Project Sentinel and City of Palo Alto for the administration of this program has applied under this category. The staff received applications under the Economic Development category from Downtown Street team and from Mayview Community Health for the renovation of a dental clinic under the Public Facilities category. So the CDBG programs operates under a 2-year funding cycle. Fiscal year 1920 is the first year of the 2-year funding cycle. Recommendations for funding are now required for fiscal year 1920. The HRC selection committee consisting of Commissioner Lee, Commissioner Brahmbhatt, and Commissioner Stinger, yeah. We met on February 25th, 2019, and made funding recommendations, which are provided as attachments C of the staff memo. Since the city has not yet received its entitlement amount from HUD, it is necessary to come up with a contingency plan in the event that there is an increase or a decrease in funds. The HRC selection committee recommended that the increase in funds be distributed according to the following contingency adjustment. For public services, in case of funding increase, maintain recommended funding levels for Catholic charities and YWCA. Prioritize funding for Silicon Valley Independent Living from recommended $6,000 to $12,000. Once SVILC is at $12,000, distribute the additional available amount between Life Moves and Palo Alto Housing Corp. Equally. In the planning and administration category, it was recommended to distribute the additional available amount equally between Project Sentinel and the City of Palo Alto. For the remaining 2 categories, in case of funding increase, 3 parts of the additional available funding should be provided to Downtown Street team and 1 part to Mayview Community Health. Again, for budgeting purposes, we have estimated the city's entitlement grant for fiscal year 1920 based on a 10% reduction in funds from fiscal year 2018 and 19. However, after the selection committee meeting, we decided to request a contingency plan in case of a further decrease, because we were going through some documents and we noticed that once there was a 17% decrease. It was just once, but in order to avoid another public hearing, we thought we might request the HRC to come up with a contingency plan in case of a decrease in funds. So I would now request to open the public hearing, take public comments, and recommend funding allocations and a funding contingency plan for when the allocation is finalized. Thank you.
Okay, Valerie? Valerie or Steve, do you want to lead your charge here and maybe begin with some questions? I know that you've spent a lot of time reviewing these applications. And do you have any clarifying questions that might help? I think you should ask a few that would kind of summarize the work that was done and where we currently stand.
I can make some comments. I'm not sure that I have any. Thank you. I'm not sure I have any. Let me try to think of a way to phrase that into a question to.
Well, as an example, the funding worksheet in attachment C. Maybe you could just clarify these columns and help us to understand what's being requested.
I'd like to try to do that, because we did look at these applications very carefully, and we say this every year, that it's really hard to try to satisfy all the needs and do justice to the good work that's being done. I guess beginning from the YWCA of Silicon Valley and the Catholic Charities, which are the smaller of the grants. We were trying to respect the work that they did uniquely in the community. Catholic Charities being an ombudsman program, the YWCA being a hotline for domestic violence. They were unique programs, and we wanted to respect them and try to meet their needs and have a minimum that would make it worth their while. There is an administrative cost to accepting a grant, and we wanted to at least make that minimum level.
So in connection with these numbers, where it says request fiscal year 2019, is that the amount that the subcommittee decided upon, or is that the amount that
I'm
was
sorry.
being requested by?
That was the application amount, the amount requested in their application to CDBG.
I see, and
So I may have a question that may help explain that.
Good.
Question to staff. So if you could go over the initial equation that you had presented to the committee in terms of taking the difference between how much funds we expect to have, how much money was requested, and then that 47% reduction. Could you explain that to the commission? And then from there, we can provide some context as to how we went from there.
Okay, so in total, all the applicants are requesting a total of 748,782, and we have 661,045 to allocate our funds. I mean, those are our funds available at this time. We might get more because the numbers are based on estimations.
And then from there, you did in your initial staff recommendation, you did a 47% reduction across the board, correct? You want to go over that?
Do you have the selection committee?
When you presented it to the,
Okay, sorry about this.
No problem.
so I believe what happened was, given that there was a gap in funding, and the amount of funds that we're expecting versus how much was requested, staff initially came to us with a set of numbers that proportionately reduced all of the requests down by 47%, and what it would look like if we distributed that gap in funding equally, right?
Oh, yes, yes.
So we started that sort of as the baseline. What would the numbers look like based on the actual funding
47%,
available?
yeah.
47%. And then from there, based on our review of the applicants and the number of folks served in the proposal compared to previous years, and how that translated into a per person, per dollar number, we tried to adjust upwards or downwards based on that equal distribution. So, for instance, for Catholic Charities, they had requested 10,000. When you apply the 47% reduction, that would bring it to $5,600. And based on just their performance, we thought that they overperformed compared to some of the other applicants, so we recommended funding above their proportional reduction, if that makes sense. Whereas, let's see, Silicon Valley Independent Living Center, their 47% reduction number would have been 16,000. But obviously, the committee's recommendation was 6,500, I believe.
Yes.
And so that's
6,000.
6,000. So that was a reflection of our review of their application, whether it was sort of on par or, above or below that sort of reduction line, if that makes.
so.
If I could interject on that particular one, their application was for more funds, that usually it's just a bump up, but theirs was for additional funding as, so it was quite a bump up from their previous year.
Looking at the attachment C, there's a list of providers or agencies on the left. How many of those agencies were previous recipients of the CDBG grants?
So except for Mayview Community Health, all of them are previous recipients.
Okay, so the Mayview is
Is
the
the new-
only one that is new.
Yes.
Okay.
And that's also the only one that is a build project. So
Yes.
that could be funding for 1 year.
1 year only. It's a capital project.
And then we would have additional funds to distribute in year 2.
Was there a template of criteria that the evaluation committee used? Stephen mentioned overperformance from the previous year.
Yes. So if you see attachment E, we have provided the semi-annual, so we ask all the subrecipients to submit a semi-annual report. So there are numbers. So by December 2018, all the subrecipients, they have achieved this goal. So for example, for Palo Alto Housing Corp, the annual goal was set on 131, and by December 2018, they already have achieved 140.
What does that number mean?
So they
131?
have assisted 140 persons in their shelters.
Okay, so these are recipients of services?
Yes,
That
yes.
they provided?
Yes,
Okay.
yes, all of them.
And you provide some clarification, Chair Gray, like, there was a grid of criteria that we considered, but it wasn't so formulaic in the sense that we graded each criteria and used the grid to determine the funding allocations. It helped guide our thought process, but it was much more holistic in terms of whether in terms of how we actually made our recommendations.
Great. And may I just ask, in the context of the work that this side of the table did on his RAB, we were very impressed by the amount of time staff spent in review not only of the applications and processing them, but also visiting each of these sites. Maybe you could just kind of describe the process that you underwent and how many hours you spent
Sure.
going through all that.
So for the subrecipients, every other year we monitor them. Like in fiscal year 17-18, we monitored Downtown Street Stream, Life Moves, and Silicon Valley Independent Living Center. So we have actually made our notes in attachment B.
Very good.
Yeah. So you'll see staff notes where we have mentioned what our findings were of the monitorings. Like for Catholic Charities, there was an audit in 17. We reviewed their quarterly reimbursement requests, performance reports, program files, financial records. So in general, we found that they compiled with the federal CDBG regulations, and all the reimbursed costs were, appropriate and as per what HUD usually looks for and asks for. So this is just an example for Catholic Charities.
And let me just, as you went through that example, I was looking down attachment D,
D, yeah.
as in David, and I did not see Catholic Charities. Did I just miss something?
D, okay, so D is the con plan goal summary. So, we have a con plan. That's kind of our master plan for 5 years. So, so we decide for example, these are the goals. Number 1 is affordable housing. Number 2 is homelessness. Number 3 is strengthen neighborhood. 4 is fair housing. 5 is economic development. So your subrecipients comes under this category. So, like for example, Catholic Charities come under strengthen neighborhood goal. Downtown Street comes under economic development goal. So we haven't named the subrecipients, but these are the goals that we are getting from the con plan.
And did you feel comfortable giving your input to the subcommittee members?
Yes.
It was very useful to us. It was very useful to us.
Very good. Commissioner, we're now just asking some questions of staff on the CDBG grant. If there are any other questions, I've asked all of mine. I'd like to invite other commissioners to ask staff questions.
I have one quick question regarding the recommending the funding. So since currently still not final yet, if there's some change, are you planning to do a proportional adjustment or, based on the need? So what's the policy regarding the change?
The change in the funding?
Yeah, right.
If we can get more or less.
Right, right.
Yeah, so that's the contingency plan that we
Right.
requested the selection committee, and they, if you see the report, do you have a copy of the report? This is the selection committee. Okay. So see the contingency plan on page 3 of the report. It explains in case of an increase of fund, how to allocate the fundings.
Okay.
And in case of a decrease, since the numbers are based on a 10% reduction already, we did not ask for a decrease funding. In case of a decrease in funding, But after the meeting, we discussed that in case of a decrease more than 10%, we do not want to come back again to a public hearing. So today, maybe you can recommend a contingency plan in case of a decrease, because in case of an increase, we already have a plan.
So the funding recommendations assumes a 10% reduction from prior years, and then we made a contingency plan if we actually get that 10% back or any additional on top of that.
Additional.
And staff is saying, since the meeting, we may experience a larger decrease of 17%.
Yeah.
So we may need to discuss that as a commission in terms of
Yes.
how do we want to plan for that if we have a 17%
Yes.
decrease?
Or more.
Or more.
Or more.
Yeah.
We-
What
we
is
have-
the pre-
we have not heard anything that says that's going to happen. It's just,
Yes.
being
Careful.
cautious.
Cautious, yeah.
What is the present action step that you would like the commission to take this evening?
So we would like you to recommend, if you agree with the selection committee recommendations, we already have a contingency plan in case of, if we get more funding. We don't have a contingency plan in case we get less funding. So we would like you to please come up with a plan in case we get less funding than what we have right now.
So we would approve the subcommittee's recommendation and contingency plan, which is only for more funding.
More funding, yes.
If there is less funding, then we'd have to come back.
Yeah, so this is what we are requesting, if you can come up with a plan tonight, so that we don't have to come back if there is a decrease. Because after, so when the final allocations are announced by HUD, so we have actually 45 days to submit our action plan. So we want to utilize that time, and because the HRC usually just meet once a month, so we don't want to delay the submission of our action plan to HUD.
Okay, and could I hear from Commissioner Stinger or Lee on your recommendations for the lower amount contingency plan, so we have a clear
Yeah.
picture?
So for that piece, I think we need to reserve that for the actual discussion portion. I think we're still in the question of staff section. So,
okay.
But during the discussion section, we can,
You
as a
have
commission-
something that you want to
I mean,
present, or, okay?
We don't have anything to present, but certainly we each have notions of what that could
Great.
look like.
Great.
And the
Well,
commission can adjust it accordingly.
Perfect.
Our discussion at our subcommittee meeting was assuming a 10% decline, and that's what's reflected here. And if we want to reflect another 7 or 10% in addition to the 10%, we would do that during the discussion period.
Excellent. Okay, that's clear. Any other commissioners have questions for staff? And we'll move on to item B, which is the oral communications from the applicants. Okay. The first up is Pi Venegas. Is that right?
Yes. You go right there and push the red button. And,
And if you could just please introduce yourself and tell us
and
your connection to the CDBG process, we'd be
Eh,
grateful.
And if I could just interject, Chair, are you doing 3 minutes per person or 2?
Yeah, if we could do is that enough for you, 3 minutes, or you?
It's 3 or 2.
We've got quite a few speakers tonight.
And are we,
All right.
and are we doing both public and applicant comments at the same time? Do we
Yeah.
have any public?
No,
public?
there's no public.
It's all applicants?
All applicants.
Okay, great, okay.
Okay. Go right
Hi.
ahead.
Is this good? Okay. Hi, my name is Pi Venegas, and I'm here today representing Silicon Valley Independent Living Center. And yes, we were one of the agencies recommended to increase the funding. We're one of 28 centers for independent living in California and 400 nationwide. And we are a disability service agency working with folks to determine their choices and based on their dignity and, just fully participate back into society. Of the 12 independent living support tools and services that we provide, we serve over 1,100 unduplicated consumers per year, and 75% of those come in for housing services. And I want to say thank you for the previous years in funding. Last year, we served over 24 consumers and unduplicated clients, and we were able to place 7 of those individuals back into the community or in accessible integrated housing. The method and the strategies we use are we really focus on prevention, diversion, and housing-focused solutions and financial assistance. And what we do is we really provide the tools and resources to get them to be motivated for their housing search. And sometimes that might include, one-on-one housing counseling sessions. And that's different, where you were unique from case management, because what we do is we really try to do person-centered planning, and that is set goals, realistic goals. And we don't hold hands. We don't say, oh, we're going to keep doing this for you, because we really want to see that they're motivated to do this. And we see that's very effective working with individuals that are motivated. And one example is that we had an individual that was making 6-figure a year, and unfortunately he got injured at work. His brother became ill with cancer. So he made a life choice. I got to take care of my brother. So things happened, and he was let go from his job, homeless. And he didn't know how to navigate the community or services. Came to our center, and instead of holding his hands all the way to the social services, we instructed, these are the steps you need to take. We want to see that you can do this, right? I mean, that's the first test for us, and to really see that this individual is motivated. Came back, and he's like, what, people like me, I've been living off on 6-figure. I have no idea how to navigate. So he was very thankful to receive the services and tools and support. And we offered him a position at our center, and that gave him the direct, personal, unique experience working with our individuals. And now he's able to really just move on and, provide that information and work with consumers.
Let me just ask briefly, where is your organization located, and how do persons find your organization?
So yes, we are in, our headquarters is in downtown San Jose, and then we have a branch office in Gilroy. So we provide housing workshops here at the Palo Alto Opportunity Center, and we get a lot of Palo Alto residents at this workshop because we're unique.
I'd like to thank you for coming in,
Yeah.
and thank you for your commitment.
Yes, you're welcome. Thank you.
Okay. Our next speaker is Ann Marquardt. Ann, welcome. Thank you for being here this evening.
I'm here representing Project Sentinel, a fair housing agency, at least providing fair housing services in Palo Alto. The agency provides 3 different types of services in Palo Alto. They are all housing related, but we provide staff support for your Palo Alto mediation program. We also provide mortgage counseling and intervention services for those people facing possible foreclosure. And then the third distinct service is the fair housing one, and that's what I'm here before you tonight on. We provide fair housing services through community outreach education and complaint investigation. On the outreach education, we develop and distribute multilingual literature on the various protected categories under federal and state law. We also have a 35-page booklet for property owners on how they can operate their rental property and stay within the law, and that's in English and in Chinese. Then we, for complaint investigations, just to mention, we have had 2 recent cases that were fairly interesting. One was with a homeowners association where they had overly restrictive rules of conduct for families with children. We were able to go in and get those policies changed to be more reasonable for how the children behave on the property. The second case was the President Hotel case, where we represented 2 of the last residents in the hotel. We were able to represent them because they have disabilities, and that would fit their situations under the fair housing laws, and we were able to negotiate, or at least help them negotiate their move-out package. We bring with us some federal money. We were just granted a 3-year award by HUD to help with the fair housing services one grant with outreach education, the other one was with enforcement, and we share that with all of our funding jurisdictions. One new addition to the agency is our in-house legal counsel, so we can give legal advice to callers for fair
Tell us
housing.
how long you've been with Project Sentinel.
How long I've been with?
Yeah.
What a mean 40 years.
Wow.
Next
That's
question.
That's a tremendous commitment. We thank you for your efforts.
Yeah, thank you. And I'm also a Palo Alto resident too.
Right.
so.
Thank you for being here tonight.
Okay.
Okay, we're going to turn to Ken Graham. Ken says CFO of Mayview Community Health. I understand, Ken, that you're a new applicant to the CDBG process?
Yes.
Okay.
Actually, I'm CEO of Mayview. And
CEO, pardon me.
I just want to make sure that CFOs don't get offended,
Sure, sure. That's the beautiful jacket and white shirt.
There you go. Good match there. Mayview Community Health has been serving Palo Alto since 1972, so we've been serving pretty much in plain sight on the first floor of the county courthouse over on Grant Street near California. We have been the primary outlet for Medicare, Medi-Cal, and county patients during that period of time. District 5 in the county does not have a county clinic in this area, so we are the contractor for that in Palo Alto, Mountain View, and Sunnyvale. The request tonight is for a capital grant for partial assistance in constructing a dental program. The dental program is new to community clinics. It's been proven to be an overwhelming service in other locations. We expect about at least 25% of our patients will receive benefits from this project. And according to some of the strategic planners, almost 70% of all patients in this payment class basically are needing dental care, screening, cleaning, and cavities and that kind of thing. We will not be doing surgeries in that classic sense. We appreciate the staff report, and we were here to thank you for that, and appreciate the staff's recommendation.
On the services that you're offering in the building that's being built, could you just describe it a little bit?
Well, actually, it's a building that was built in 1978 or so by the county. It's the same, it looks like 1978. We're converting 2 administrative spaces into dental suites.
And where is that located?
It's on the first floor of the courthouse on 270 Grant. It's about a block south of California Street and Birch.
Okay, and
So when you drive to the courthouse or by that, we're in the
Right.
first floor, right next to Mr. Simidian's office, so that you know.
okay, so
Yeah.
right here.
Yes.
All right.
And
we
that's where our
welcome you.
headquarters is for our clinic. So we're a Palo Alto company with about 30 employees at that location, about 70 in the other locations.
How many patients do you think you'll see in the dental services?
We're going to see about 500 in the first year,
500.
and then we'll probably see 3 visits or so, 1,500 or so visits per the first year.
That's fantastic. Thank you very much for coming in.
Okay, thank you for your support.
Appreciate it. Just a break here, I wanted to mention to those present, if you want to speak, we have speaker cards that look like this. We did have a public speaker session ahead of time. It was agenda item 2, but these are speakers for the CDBG process or speakers for the HISRAP review, which will come later. And I know that the Mayview group is coming later. So our next speaker is Linda Dominguez. Linda, welcome.
Thank you.
How are you doing this evening?
I'm doing fine. Thank you very much for this time.
Yeah, thank you for being present.
Once again, my name is Linda Dominguez. I am with Catholic Charities. I'm representing the Long-Term Care Ombudsman Office program of Santa Clara County. Our program is we advocate for residents who are in facilities. Our program is a free program. We oversee 4 nursing homes and 8 6-bed homes with the quality of for residents of 1,255 residents, and they are overseen by 1 staff member, and that's me. We come and help out with residents who have issues with abuse, neglect, financial abuse. We also support the family in helping them cope with their residents or loved ones who are entering into a facility. And we would like to thank you very much for your support.
I happen to be a long-term care ombudsman, but up in San Mateo County.
Wonderful.
Tell us a little bit about how you got interested in this line.
Well, life gradually brings you into different jobs. I first was working with the children's mental health for 15 years, raising my children. I worked with the children who had ADHD, and it just so happened that my children had ADHD. So I was there to learn as well as give my support. And now, as my parents are now in their elderly years, it's great that I can learn more about working with seniors and also be a support to my family. So it kind of works hand in hand together, working with the facility and with the Catholic Charities.
I know it's hard work, and we thank you for your commitment.
Thank you very much.
Thanks for being here. Maureen Damrell. Maureen, welcome. How are you this evening?
I'm doing well, thank you.
Thanks for being here. Tell us a little bit about your interest in CDBG.
So I'm Maureen Damrell, and I'm representing Downtown Streets team this evening. I'm the director for Santa Clara County. We've been lucky recipients of CDBG funding throughout the years. Palo Alto is actually where we started Downtown Streets team in 2005, and we really feel ingrained in this community. It's our home. What Downtown Streets team does is we run a work experience team for adults experiencing homelessness, helping them to get back into employment, take on any roadblocks that are really stopping them from progressing their lives and becoming more self-supported. So throughout CDBG funding, we are able to really have the capacity to help the people who are experiencing homelessness, but we also have the capacity to outreach to local businesses and in hopes of creating employment pipelines to secure employment for people who may have not been working for a long time. It comes through a lot of conversations and relationship building, which can only be done truly in person and face-to-face, kind of trying to expel the perceptions of homelessness. So we're very grateful to be continually considered for funding, and we look forward to helping more people understand what it is to experience homelessness, how it affects our community in various ways, and really empower those who are facing this monumental undertaking in their own life to feel empowered and supported by their community.
Would you share with us one of your recent case successes?
Oh, yeah. Here in Palo Alto, actually, we've had, I will call her Charlie tonight, and in lieu of using her full name. And she's been a lifetime resident of Palo Alto. She raised children here who went to local schools. All of her children are now adults. She was once a homeowner, a 5-bedroom house. She still actually holds all of her everything that went in that house in storage, because it's really hard to leave parts of your life behind, even if your life has changed. Just in the past few months, she was able to establish housing that was in a safe place. She's has a myriad of physical ailments and lots of things that are placing her in any other place would be extremely unhealthy for her and putting her life in danger. So now she's sharing an apartment with a woman close to her in age, so she feels safe there. And she's able to receive the consistent care, because some care is not offered if you don't have a consistent, safe place to stay, and if you don't have a place that the outreach vehicle can pick you up and drop you off from. And so Charlie's been going to all of her doctor's appointments. She is one of our managers on our team who volunteers in the food closet throughout the week as well.
We really appreciate your commitment. Thank you for your work.
Thank you for hearing me tonight.
Okay. Philip Daw. Philip, good evening. How are you? Thanks for being here. Tell us about your connection to the CDBG grants.
Hi, my name is Philip Daw, and I'm the director at the Opportunity Center for Life Moves. Life Moves has been partnering with City of Palo Alto for so many years. I've worked at the Opportunity Center for 16 years, and I just want to highlight a few things that we have been doing, and also especially with our EAN program, which is a network of financial assistance agencies within the county to provide services for low-income Palo Alto residents who may be losing their homes. Had it not been for these rental assistance programs, we would still be bringing a lot of homeless people into Palo Alto. But because of that, we're averaging 8 clients per month requesting rental assistance to be able to maintain their housing. And we are also averaging $1,750 per request. Another service we provide is the only all-year-round shelter in Palo Alto, which is the Hotel Design Shelter, which we partner with local faith-based organizations to house 20 clients each night. And as we speak, there are 15 clients sleeping at the shelter in a church in Palo Alto with hot meals, and will receive case management services at the Opportunity Center. And the end goal for them is to be able to find housing, of which when they find this housing, we use some of this rental assistance money to be able to pay their deposits and first month's rent in order for them to be able to move in. Another critical service that we provide is our Breaking Bread Hot Meal program, which is the only, not the only, but we provide meals 5 days a week at different church locations and also at the Opportunity Center for homeless people to have a place and also a community where they can hang out. Our drop-in services, which is at the Opportunity Center, sees an average of 80 clients per day. And last year, we saw 425 unduplicated clients coming into the center to receive basic services that were not available to them. We have also been working with Stanford Law Clinic lately to continue. We had a break in it, but we have been working with them to help people apply for Social Security benefits because a lot of homeless people are disabled, but the bureaucracy with Social Security applications is really very difficult for even regular folks to go through. And so our contact at Stanford Law School, Lisa Douglas, and her students come to the Opportunity Center every Friday to help clients apply for those services. And because of that, we've been able to at least have people earn or have received these benefits that they do qualify for. And I want to thank the CDBG and his rep committees for all the assistance you've given us over the years. Thank you.
I just want to ask about your clients. Are there families involved in your work with children?
Absolutely. We see a lot of family homelessness at the Opportunity Center. And most of those family homelessness are low-income Palo Alto residents who lose their jobs or get sick and don't have money to pay their rent. And that's when our emergency assistance funds come in to be able to supplement their rent for a month or so until they can get back on their feet.
Thank you for your commitment.
Thank you.
Okay. Jessica Clark. Good evening, Jessica. Are you here? Won't you come up and say hello?
I think I'm in the next section.
Next section. You're right. Okay, we got a lot of twos in here. Let's see, any more ones? All twos. Okay, we're done with section 1. Wow. Great presentations. Thank you all. We're going to turn to discussion and consideration of the selection committee's funding recommendations and the contingency plan for higher level and lower level funding.
So my personal recommendation, because we haven't had a chance to discuss a lower reduction than 10%, my personal recommendation would be in the event of a larger reduction that we do it in proportion to the recommended funding levels.
How did the upper level, Stephen, how did if the money is more, how did you come up with that contingency? What was the formula?
It was similarly in proportion to how we break out the current recommendation.
Okay, so
if there was a 2-to-1, for instance, allocation, any increase would be, actually, no. I misspoke. Yes, that's right. Yeah. So thank you for correcting. For an increase, we decided for SVILC that it should first go to that entity with a cap at $12,000. And then
you might want to use your microphone so we can all hear you.
So any increase would first go to Silicon Valley Independent Living Center, up to a cap of 12,000. Is it 12,000?
Yes.
And then anything above that would be split between Life Moves and
Palo Alto.
Palo Alto Housing Corporation in equal proportions.
Okay, so how would that work out if it was less money? What would you do?
Then it would be to Silicon Valley Independent Living Center first, until they reach 12,000. So if
Okay.
we only had 10,000 more, then it would go all to them. If we had 14,000, it'd be 12 first, and then the remaining to Life Moves and Palo
Okay,
Alto.
let's ask staff if that's clear. Is that clear to you, how Commissioner Lee has described the lower contingency amount?
No, I am actually not clear about the lower contingency. I am clear about of course, if the levels are increased.
Maybe
So-
you could ask Commissioner Lee questions about that.
Sure. So so you would like us to maintain Catholic Charities and YWCA at $10,000 and $5,000 in case of a decrease?
Well, my
Let's-
personal recommendation would be in proportion, but we can discuss whether we want to do something different.
I
Yeah,
guess,
I think we'd like to hear what your recommendation is first, and then we
Well,
can,
well, as a committee, we didn't discuss a larger decrease. We only
is new-
contemplate,
new
it's a
information
new
tonight.
item.
Oh,
We only
okay.
contemplate a 10% decrease.
okay.
now we're
Great.
being asked to add another 7 to
7%.
10%. And I guess I would argue that maybe we should look at a further 10% so that we've bounded the, any possibility.
Up to 10% lower is what you're saying.
An additional 10%
An
lower.
additional.
We've already taken 10%
Okay.
out of, and then we did that in our committee meeting.
All right. Why don't we take one at a time, and then you can come up with your thoughts, and then we'll discuss each of the thoughts. Go ahead, Stephen.
I just want to make sure that we're clear. So the column here, on the very right-hand side under selection committee recommendation, that already assumes a 10% reduction
Yes.
from what we got
Yes.
last year. So that's baked in. What we're asking now is if there's a further decrease, say a 12%, 15%,
Yes.
17%, how would we adjust these numbers here in this last column? I would recommend that we adjust it proportionately based on, if you do the ratios here, how that pencils out.
Are there minimum grants?
I don't believe there are
We-
minimums.
There are no
but
I don't
minimums,
think we
but-
have an official minimum, right? We try
Uh,
for 5, is
For
that
the,
correct?
yes, for the city of Palo Alto, we haven't have like official, but as per HUD regulations, we should at least provide $5,000 to a subrecipient.
It's a lot of work for the subrecipients, to all the regulatory things that
Yes.
we need to do.
Okay,
So
I
that-
think I understand
yeah.
it. Commissioner
Yeah.
Stinger, do you have any other thoughts about this?
I do. For this is slightly different than the HISRAP because each category has limitations. So for the first category, public service, there's a 15% cap. And so we were distributing money within that. And I might suggest that 3 of the agencies, Catholic Charities, Silicon Valley Independent Living Centers, and the YWCA of Silicon Valley are sort of at a minimum level. And to decrease them another 10% would almost make the grant unusable.
Right.
And I,
So your thought process would be to
To-
keep those 3 the same, and then with respect to Life Moves and Palo Alto Housing, you would decrease that proportionately
to
based
stay
on
within the
the 15%.
total, yeah, the public service subtotal that was our target, would be our target.
How about the other 2 categories?
So I
Planning.
think I had a suggestion as well.
Okay,
So in this, I think the YWCA is not using and is not receiving that many number of people who need support. So I think we could, and we were debating of giving them lower than 5K, but then went with 5K because of the HUD minimum.
Yes.
So I think if there's a further decrease, we could just eliminate giving anything to YWCA. Because they're not getting that many calls for help or, need. And every year it's less and less people, and I think there was just like 1 or 2 people who were helped last year or something like that. So that would then.
I would agree
appreciate
with
that
that.
input.
Yeah.
We did have that discussion that
Yeah.
it's the only group that's dealing specifically with domestic violence, but they're not the services aren't local and don't have enough outreach. And, yeah, I would stand with that.
And then we could decrease proportionally with others and keep Catholic Charities at 10K, but like decrease with others.
Okay, so we have two alternates right now.
And if I could modify mine based on the feedback I'm hearing from my colleagues.
Okay.
I agree with Commissioner Brombatt's suggestion regarding YWCA. It's unfortunate, but if need be, then I'd say that one would be the first to go. I'm okay with keeping Silicon Valley Independent Living Center at 6,000. For Catholic Charities, I'd say that should be decreased, but capping the floor at 5,000 so that it's, meets that sort of minimum threshold of being administratable, and then any other decrease being in proportion.
Okay, Commissioner Onan.
So I disagree with that plan. Catholic Charities is overperforming, and they provide a unique service that no one else duplicates. So I understand Commissioner Brombatt's suggestion about dropping the $5,000 grant from YWCA if a further increase is required. By my math, 10% of 80,000 would be 8,000. Is that correct? Do I have that correct? So if we dropped 5,000, we only have to come up with a 3,000 additional reduction, and I think that should be shared between Life Moves and Palo Alto Housing because they are the two largest grantees, and they would not miss the $1,500 each as much as the other agency would.
Okay, Commissioner, shoot, go right ahead.
Yeah, I agree with Commissioner Onan's suggestion. I think that's fair.
All right, I guess there's a couple of proposals. Stephen, why don't you go ahead and would you like to?
I'll move to approve the committee's recommendation, the contingency for an increase, and I would add to that, in the case of a larger decrease, that we first take it from YWCA, then from Catholic Charities, but keeping a cap on it at 5,000, so it doesn't go below that, and then in proportion from the remaining two groups.
Okay.
So that would be my motion, and
Is there a second for that motion?
Could I just interject before we move forward on that?
You
We
can.
haven't discussed the increase plan.
That's correct.
And I
We're
wanted
only-
to discuss that, but this motion covers both, and so I
okay.
feel like it's premature.
Or did you want to make a motion on
Just on
pieces
the,
on it, or?
Well, I want to start with the decrease first.
Fine, okay,
And
sure.
then we can move for the entire one,
Okay, so.
Can I ask Commissioner Onan a question? Because I think you asked a legitimate question. If we haven't agreed to the Select Committee recommendation, column D on this, when we start manipulating the numbers,
We're just going to agree on identifying what the lower contingency is first.
But that might change depending on what our actual recommendation is. If we flip them numbers,
Okay.
then what we do in a contingency may alter. So maybe we want to discuss the committee recommendation first,
All
and
right.
then do the contingencies.
That's fine. I think we've had a good discussion on the lower contingency. Let's go ahead and open the discussion on the recommendation. And the Select Committee's recommendation is located in attachment C. Commissioner Onan.
So I was fine with the allocations that were proposed. My questions are really about the contingency plan if there is an increase. I didn't understand why Silicon Valley Independent Living would be prioritized over the other two agencies. And I was also curious as to why Mayview would only get a quarter to three parts of Life Moves. Or, I'm sorry, Downtown Streets team, sorry. And I just wondered if the subcommittee could fill us in on what the thinking was there.
So I guess we could probably talk about the DST and Mayview first.
Because I personally think that the building of the new dental facility is, again, a unique service for Palo Altans. It's new, it's vitally needed, and Downtown Streets team also provides an amazing service, but they are fairly well-funded to this point. And Mayview, this is a new one-time build that I would be inclined to support as wholeheartedly as we can.
So that certainly came up in the committee's discussion. I think ultimately where we ended up was We thought that the need that DST was serving was perhaps slightly more critical than Mayview. Granted, both are very important, but in at least my estimation, I thought more priority should be given to DST. And we tried to fund them fairly closely to their requested amounts. Mayview is just 15,000 below their requested amount.
Downtown Streets team is also close to their requested amount.
Right, so to me, it would make more sense to share any increase more equitably, and I wasn't sure about the 3 to 1.
So, yep. I'm sorry, when you say 3 to 1.
Didn't you say it was 3? Yeah, it's like, it says 3 parts to any additional available to DST and 1 part to.
Oh, I see. Oh, I see.
So
Okay.
if it was shared equitably, that would make more sense to me. I'm not sure I understand the 3 to 1 ratio, because I'm personally very supportive of the new dental
Sure.
clinic.
I mean, based on the fact that they're requesting different amounts, we didn't want to give them numerically the same amount, right? Given that one is asking for 300,000, one's asking for 150. Our thought was that the ratio should reflect that for any increase.
I guess we felt if we actually did the math, it would be like 2.5 or 2.6, and we just rounded it to 3 for ease of calculation.
I don't know, to me, I'm not sure that the ratio should inform what the excess would be. Because if we could fully fund the clinic, that's one thing checked, and that's a one-time bill. DST is going to be a long-term ongoing partner.
I mean, I think there was also an evaluation, again, at least for my part, because I made that particular motion in committee, that I thought that the need being served by DST was slightly higher than Mayview.
Okay.
So that is really what's explaining the.
And then can you also explain the reasoning behind the prioritization of Silicon Independent Living over the other 2 agencies?
Between Catholic Charities. Oh,
Yeah,
so,
because the other agencies serve many more people. Not that Silicon Valley Independent Living doesn't provide a critical service, but in terms of if there was an increase, would we not want to prioritize agencies that reach more people to maximize the value of those dollars? I'm just trying to understand.
yeah, are you talking about Life Moves and Palo Alto Housing Corp?
It's, it says the funding, what you said that you were prioritizing.
So Catholic Charities is already capped out, right? So that
Right.
one's gone. Between, there's Life Moves and Palo Alto Housing Corp., Silicon Valley, and YWCA. I think the committee felt that 5,000 was sufficient for YWCA. So we didn't want to allocate any increase to that. Given that we have already given so much to Life Moves and Palo Alto Housing Corp., we were willing to give an increase first to Silicon Valley Independent Living Center up to a point, up to 12,000.
Right, that's essentially a 100% increase for them, because, right, you're at 6, now you're doubling it to 12. So that's just, to me, that's a large
If I could
jump.
interject to that, that was a little bit different in that, it was last year, I think Silicon Valley Independent Living Center had 5,000, but in their application, they asked for quite a bit more funding, but they were providing more services. So it kind of put it in a slightly different category, so that's how the committee addressed it. They asked for 20, so it wasn't like they had 28,000 currently. They have a smaller grant, but they were putting forward that they would provide more services. So the committee decided that's the way to address it. They're not going to get the full recommendation, but, if there's extra funding, then they could up the funding.
Okay.
Is that correct?
It was.
Yeah.
We looked at the baseline, and 6,000 is consistent more or less with what they've received historically, but considerably under the proposal for additional services this year, and the way we felt sort of hamstrung, but the best we could do with new services was if there was increased funding available, and that's where the 12 came from.
Can I just ask, are there 3 folks that were in on the recommendation? Okay, I just wondered if we could also hear from you, Commissioner Bromlett.
Yeah, I mean, they've pretty much summarized this. We wanted to support the addition and the request for 28,000. But, given the budget, the way to do that was to prioritize when the funding, if there was an increase, to prioritize giving it to them first.
And I believe our recommendation was unanimous, correct? I think we
Yeah.
we did
Yeah.
a lot of back and forth, sort of not fudging, adjusting the numbers based on what we were hearing from each other, and we really worked hard to speak with one voice on this, at least as a committee. Certainly the commission as a whole may decide differently.
Commissioner Hsu, do you have any questions? Okay. Any further questions? Okay, so I think the discussion's finished now, and I
Okay.
think what I'd like is a member of the subcommittee to make a motion.
So maybe, Chair Kralik, if I could make a two-part, separate them out into two motions. The first motion will be on the committee recommendation and the contingency for an increase, and then we can vote on that. And then I would suggest a second motion on a larger decrease, because it seems like there's a couple
Okay,
thoughts
let's
on that.
do it that
Okay,
way. Yeah,
so,
sure.
so I move the selection committee's recommendation along with the contingency plan for an increase as presented on attachment C.
Is there a second for the motion?
Yeah, I second that motion.
Okay, any further discussion? Okay, we'll go ahead and vote on that. All in favor?
Aye.
Aye.
It's unanimous. Congratulations, and thank you all, subcommittee, for your hard work on that. We'll move to the contingency proposal for a decrease.
I'm going to defer to my two committee colleagues on this one, because I think there are multiple ideas here, and if one of you would like to present one of them as a motion, and we can discuss it if necessary.
Thinking out loud, I would suggest that we look at it by the four categories. And if there were a 10% reduction, first looking at public services, we reduced the YWCA of Silicon Valley. And then we proportionally take a hit or a reduction in the remaining four. Is that right? 1, 2, 3,
Three.
4.
Oh, okay.
And I think if we took a 10% hit at 10,000, it would be, well, it'd be $1,000.
So eliminate YWCA completely in case of a further decrease, and then
Distribute the rest.
the rest for proportionally decrease, like that would be 2,500. Okay.
Sorry, do we mean 25, do we mean in proportion to how they're allocated now, or do you mean an equal cut to all the agencies?
I was thinking of whatever percent we needed to reduce, applying that percent. So if it was 3%, we would take 3%. If we needed to cut it.
3% from each. Okay, okay. So it's not in proportion, it's to the recommendation. It'd
would
be
be just-
equally divided.
So for example, we have after eliminating YWCA, if we have $4,000 remaining, we just take $1,000 each from each agencies. Is that correct?
That's one way to put it. I was trying to make it harder and do a percent distribution to say, if we need to cut.
I mean, for instance, Life Moves has 5 times the amount that Silicon Valley Independent Living Center is getting under the committee recommendation. And so any further decrease I would recommend be in the proportion in which the committee has recommended them.
Okay, that's fine.
Okay.
I would say I still continue to disagree with that strategy, because I think the smaller grants will become, I think the reward of getting the money will be offset by the burden of having to administer such small amounts. And as I said, Catholic Charities is overperforming with their 10,000, so to cut them when it's already a modest grant, I would be hesitant to do that. I also think cutting Silicon Valley Independent Living Center lower than 6,000 gets them really close to the minimum, and I think the larger agencies can bear the burden, which would, if we remove the Y, would only be a few $1,000s that the two of them would be sharing. I think that would be a less impactful way and preserve those modest grants and make them continue to be meaningful to those smaller agencies.
Commissioner Brumbaugh, you had talked about this before, but could you tell us your thoughts about the proposal of Commissioners Stinger and Lee, and comment on Commissioner Onan's thought?
Yeah, I mean, I'm okay with doing a proportional. I think just dividing it four equally doesn't make sense because they have received different proportions. And I also feel Commissioner Onan's proposal is very reasonable with Catholic Charities, and I think I think it would hurt them because they were asking for 28, and we are giving them 6,000, and then if we want the Silicon Valley, if we reduce them further, maybe we don't reduce that one and then do the proportional with
Palo Alto Housing Corp and Life Moves?
Yeah, Palo Alto Housing.
So if I'm hearing my colleagues correctly, if I may make a suggestion to the amendment, to the motion, is that we place a floor on Silicon Valley and Silicon Valley and Catholic Charities such that it does not drop below 5,000. We meet it's not a mandatory minimum, it's just a preferential minimum that we don't fall below the 5,000 minimum.
I think that would work. Then we have a good
Do you take that as a
Yeah, I
friendly
would
amendment?
accept that.
Okay.
I will just defend where I was coming from because I care so much about all of these groups. Catholic Charities in the past, except for last year, has been in the $5,000, it's $5,000 to $6,000 grant. And so it has performed well. It is the only ombudsman service for seniors living in long-term care settings. So I'd hate to reduce it, but this is the past 2 years have been exceptionally high years for their grant rewards. Both Life Moves and Palo Alto Housing Corp are taking reductions this year from recent years. And so that's why I was trying to defend them. And I think the motion on the floor makes the most sense, and it's the easiest to administer.
Okay,
I
let's
just wanna
hear from
say-
Commissioner Shu, please.
Well, after hearing, all the discussion, I am more in aligning with Commissioner Onan's proposal. Maintain Catholic charities, 10,000, and also Silicon Valley Independent Living Centers, 5,000 or 6,000. If the actual should come from the Life Moves and the Palo Alto Housing Corporation. So,
We're going to have an interesting vote.
Yeah.
Why don't we do this? Why don't we go ahead and have a motion from,
So Valerie made a motion, I'll second the motion.
okay, could you restate it so we know what we're saying, okay?
Valerie, would you
I
like to?
hope I can say this correctly, or say what I said. I hope I can say it again. The first reduction would be YWCA of Silicon Valley, and we would remove the grant. The remaining 10%.
And when would that trigger? On
when-
any decrease?
Any decrease.
Any decrease, okay.
The first $5,000 we would take from
Okay.
the YWCA of Silicon Valley. And then,
But you wouldn't take the whole 5,000 if it was a decrease that was less than 5,000?
You would take it first from,
First from?
first from,
Okay,
and then anything above a 5,000 decrease would come proportionately from the other three agencies with a.
3 or 4?
for,
Oh, sorry, from the four, with a floor of 5,000
for
Catholic Charities in Silicon Valley.
Okay,
Yeah.
and there was a second to that motion?
I'll second that.
Okay.
Is there any discussion on it, or?
I think we did
Okay.
discuss it. Could I take a vote on that proposal?
So just point of clarification. So whenever there's a motion that's been seconded, you technically have discussion. Since we've already discussed it, we may not need to.
Any further
Any
discussion?
further discussion, yeah.
Right.
There has to be that option of discussion.
Okay.
Yeah, I vote for it, yeah. You were asking for the votes or not yet?
Not yet.
No.
Any
Okay.
further discussion? Okay, all in favor?
Aye.
Aye.
Okay, so 4.
So it's 4 all against? 2. So the motion does carry. All right, we're going to move on to The second item, ad hoc review committee recommendation to the HRC for Human Services Resource Allocation Process, funding for fiscal years 2020 to 2021.
Could I just ask for one point of clarification, Chair?
Sure.
So we just discussed for category 1.
Yes.
But what about the other categories?
Yeah. Oh. Yes, there's planning, administration, economic development, and public facilities too.
We only talked about this group.
I thought that, okay, we can.
That's correct, yeah.
Do that.
Yeah.
I thought that we had talked about,
The motion didn't include the other two.
yeah, so could we have a motion that includes the other two, please?
So, Commissioner Singer, if I would suggest maybe for the other two categories, within their proportionally reduce them.
I think that's fair. It's unfortunate, but it would be fair.
Okay, could you make the motion, please?
There are categories of planning and administration, economic development, public facilities, and housing rehab. And if there was another 7 to 10%, if there was another reduction in funding from HUD, we would spread that proportionally across the four agencies in the three categories.
Okay, is there a
Second.
second?
Second.
Okay. Discussion. Okay, could we have a vote, please? All in favor?
Aye.
Aye.
Aye. Okay.
Thank you for catching that.
Just, and for clarification, we have now voted in favor of the selection committee recommendation, the selection committee contingency on increase, and the selection committee contingency on decrease. And we appreciate the subcommittee's work.
Well, the
Thank you
decrease
all.
wasn't from the committee, it was at commission we
At
made
the
it.
HRC.
Because
At the meeting.
we hadn't discussed it previously.
Very well.
Yep.
All right, moving to the second item. First, we're going to have Commissioner Onan lead us regarding the his RAP funding process. The review committee consisted of staff members of the commission and the three of us right here, Commissioner Onan, Commissioner Shu, and myself. Commissioner Onan.
Okay, thank you so much, Chair. Thank you so much, Chair. All right, so this is our year for our 2-year HISRAP funding cycle, and as always, the amounts that were requested from the RFP process far exceeded the actual budget that we had. The amounts requested were $712,690, and the amount that we had was $515,792, so almost $200,000 difference. So obviously a very difficult task for us. What we determined, though, in our deliberations was that there were a number of relatively modest grants, and there was available funding to award those grants either as a significant increase or to fully fund certain agencies. And so those agencies were, sorry, I'm looking at the chart. Sorry, I've lost my place now. I'm just, God, I'm trying to say, yeah, I'm sorry. They were Cassie, Abilities United, Cassie, Downtown Streets Team, Dreamcatchers, Cara, La Comida, Mayview Health, Palo Alto Housing, Senior Adults Legal Assistance, Vista Center for the Blind, and Youth Community Services. So that was the easier part. Then we had to look at some larger grants, and we also had to look at requests from new agencies and try to determine how to use the remaining funding for them. So we first talked about adolescent counseling services. That agency has a very long and venerable history with the city. They were at one time one of our largest grantees, then their funding had been decreased because they have a different relationship now with the school district than they used to have. But they asked for more money this year, and we did agree that dealing with mental health and drug rehabilitation issues and giving support to LGBTQ youth is critical for our community. We have a strong focus and priority on youth well-being, so we have agreed, we recommended that their grant be significantly increased to $42,500. We also talked about moving up the funding for Life Moves. Life Moves administers a very critical Breaking Bread food program. Nutrition was one of our priorities for the community. It is very shocking, but even here in Palo Alto, food insecurity is a big issue for low-income people. Many people, up to about 100 a day, depend on the Breaking Bread program. So we agreed to move their funding up to, 78,911. But part of that funding, we also would like to go to the salary for a new public safety officer.
So not a police officer, but a
Public safety,
manager.
a safety manager for the Opportunity Center. The Opportunity Center is another venue where homeless people and families receive meals, snacks, counseling, and other services. And there is a need to have a safety officer or safety presence there. So we were very supportive of that as well. Then we had to turn to the newer agencies. These were the Health Trust, which administers Meals on Wheels, Ada's Cafe, which is a well-known cafe over at the Mitchell Park Community Center, and Blossom Birth. Because we are prioritizing food-based programs, we were supportive of the Meals on Wheels program. They are serving a group that has not been served by our existing food programs because these seniors are homebound. So we agreed to give them a grant of, looking at my chart here, $10,000. We then looked at the request from Ada's Cafe. Ada's requested a very large amount, and because they're a new agency, we didn't feel that we could grant such a large amount to pay for their executive salaries. But we also had some questions about their application. There were some deficiencies there. But we did decide that we would allocate $5,000 to Ada's. And then the final agency was Blossom Birth, another new agency. This agency also had some deficiencies in their application. Two key problems that came up was they requested an amount that was more than Palo Alto could be served by. They didn't have enough Palo Alto clients to justify a $15,000 grant. In fact, they didn't quite have enough Palo Alto clients to justify even a minimum $5,000 grant. That was one problem. And two, they were targeting a demographic whose average income was over $100,000 a year. And while his RAP funding does not have strings attached to it, we generally try to direct the funds toward lower income people. So we decided not to fund Blossom Birth at this time. So they were the only agency that did not get a recommended funding allocation. And so that was the thinking behind our current recommendations, and we welcome the feedback from colleagues and the public who are here today.
Can I ask a clarifying question, Chair?
Right. This is the time to do it.
So between the 10 agencies that you looked at first, that you either fully funded or increased the funding for, between those 10, what was the thought process in terms of whether an agency got fully funded or how much of an increase in funding? How did you break out those 10?
Well, one constraint that we had was we cannot overfund agencies.
Sure.
We can't fund
Yeah.
more than they requested. Some agencies only requested a few $1,000s more, and it felt like their request, their application was strong, they'd worked with the city for a while, and what they were requesting was reasonable. Other agencies requested really significant increases that would have taken quite a bit of the budget away from possible other grantees, including new agencies that we were interested in looking at. And in some cases, the amount would have doubled what they're currently getting, which seemed like an excessive amount of increase. So we were trying to be cognizant of all these factors as we made our determinations. So some agencies, may have gotten a $10,000 increase, but not a 15, which would have doubled them and put them ahead of another agency which was equally deserving. So we tried to make sure people got enough funding, because typically the funding was for staff positions, that they could reasonably expect to serve Palo Altans and possibly make up the rest of the funding through their additional fundraising efforts.
So
Let me just say
Okay.
that when you're talking about thinking, I think there was a consolidated opinion formed after much discussion. So each of us had our own perspectives.
Sure.
They were different. And we didn't always agree, but we did come to a consensus after formulating and listening. Staff had a big input. Staff has visited each of these agencies. They've also interacted with the agency to address follow-up questions. We had 2 meetings, and then we received the follow-up input. In situations where we didn't understand the submission or we felt that clarification was needed, we received that, and then we came up with a consensus viewpoint. I will say that the Blossom Birth, not funding it was not my opinion, but it was carried in a 2-to-1 vote.
So the way that the memo reads, it seems like the 10 that were either fully funded or had increase in funding came first, and then you considered the two larger increases. Was it really a two-step process, or?
We went one at a time
You went
and walked through each one of them on their own merits.
Okay.
We did it twice, actually.
So it wasn't like you tried to fund the first 10 first and then?
No.
Okay, so okay.
Yeah,
Thank you very
one
much.
at a time, sure.
Yep.
Commissioner Brombach, did you have any questions of the subcommittee?
No, you're good.
Okay. Commissioner Stinger?
No, I did have some questions, but you've answered them.
Okay. All right, well, we're going to turn next to the oral communications from the applicants. We have quite a few cards.
Did you want to do 2 minutes then, or 3 minutes?
I'll try to hold all my questions, which apparently delayed us the last time. I'm going to have a couple of the folks come up again who have a 1 and 2 card.
So 2 minutes or 3 minutes, Chair?
A couple minutes, 2 minutes.
Okay, thank
Yeah.
you, sir.
Yeah, but try to feel comfortable, folks. You've spent a lot of time coming here, and we really appreciate your time and commitment to the community. Philip Daw. Okay. And Ken Graham, CEO. CEO. I got that right this time.
Well, thank you again. We do appreciate the opportunity to receive this grant. We support the staff's recommendation, both upward, downward, and around. This program will provide care to 222 more residents, and about 40% of those will receive behavioral health services in addition. Thank you very much.
Thank you for coming in on behalf of Mayview. I appreciate it. All right, Jim Santucci of CARA. Jim, welcome this evening. Thank you for coming. Just tell us briefly about CARA and your connection to it.
Sure. So my name is Jim Santucci. I serve as the executive director with CARA. I've been in that position for over 5 years now. CARA's been in the community in Palo Alto since 1976, providing bereavement support, emotional health support for those that have suffered the loss of a loved one or someone close to them. So I just want to really be here to say thank you so much for funding our services for the community. This is the second time we're receiving funding for the cycle, so we're really grateful for that. It does a lot for us to be able to serve. And just as a short story, in my role as executive director, my other hat I wear is I'm actually a trained grief facilitator, like many of our other volunteers. And I facilitate a group of parents who've lost young children. And one in particular story, and I won't use names obviously, but this one young single mom was in my group, and she's from Palo Alto. And I've seen her be able to heal and go through that loss of her 18-month-old and just come to the groups and be encouraged by the other parents in the group. And those groups are really it's a lot of talking processing with 2 trained facilitators and those other parents who experienced that loss. And in 201, they say they can't have these conversations outside of that room, and it meets twice a month. So I see the healing work that we do every day. Even though I'm sitting in my operational office, I try to stay in the ground and stay close to the kids, stay close to the adults. I also volunteer at our annual grief camp called Camp Aaron. So the reason I do that is because I myself was a recipient of the services 10 years ago. So I have a real heart for the services. So I'm grateful for any organization, city, person that supports us, because all of our services are provided through donation. So I just want to say thank you again for the support that the city has given us.
We really appreciate your passion for this. Thank you so much for coming.
Thanks, Gabe.
Jessica Clark. Good evening, Jessica, from Cassie. I think I jumped the gun the last time, right? And okay.
I just wanted you to introduce me twice.
Right.
I'm thrilled to be here on behalf of Cassie. I joined Cassie last year, and I supervise all of the Palo Alto Unified School District therapists that we have placed providing mental health services in the schools. And this year we've added TK to our spectrum of services. So we serve all the way 4-year-olds all the way up to the high school seniors. And it's thrilling to see the breadth of work that our therapists are doing. I have the great privilege of meeting with all of our therapists every week. And I can't tell you how amazing their skill sets are, all of the variety of skills that they bring to all of these schools. And what I would like to share is that recently I've been going around meeting with the principals of the schools to kind of do a check-in, make sure the year is going well, see if there's anything that we want to tweak to make sure we're hitting all the important things in their schools. And in multiple meetings, I come in pretty even. I don't want to bias, anything. I think they're amazing therapists, but I want them to be really honest with me if there's any corrections we need to make. And in multiple meetings, I've had principals begin to cry as they describe how grateful they are for these therapists partnering with their schools and providing not only individual therapy, group therapy, but classroom support, teaching mindfulness, support for the teachers when they're stressed out over kids, giving them strategies to work with the kids, providing support to the administrators, secretaries. So we really are focused on partnering with the whole school to meet all the children's needs, and I think it's an amazing partnership that we've built with all of these schools. If I have one more second, I'll give you one more little anecdote. One of the therapists reported to me that she was called in because a child was coming off the school bus really upset. Somebody had started to tease him on the school bus. And by the time she had gotten to him, he had a couple of buddies around him. Turns out they were all from the same class in elementary school. It was a classroom that she had done mindfulness lessons in. And his 2 little buddies were coaching him on deep breathing to help him calm down. And they had done that throughout the bus ride so that he could make it to school, and he managed to pull himself together and get back to class. And that's one of the things that I just love to see, because it's not all about, there's just so much value in the individual therapy that we provide, but it's not all about that. It's about the communities feeling supportive and safe and having those skills to deal with life's up and downs. And we're getting those skills in at such a young age that I just am so thrilled to be a part of.
Well, we've given you time in proportion to the grant.
Thank you. Luckily, I talk fast, too. So
we really appreciate you reaching our youth. Thank you so much for your commitment.
We're so grateful to have your support. Thank you.
Okay, thank you. Roger Young. Roger, are you here tonight still? Thank you so much for coming.
It's my joy.
Thank you for your patience.
Sort of like Christmas. I am the manager of the Adult Day Activities and Community Connections programs for Abilities United. Abilities United provides a full continuum of services for people of all ages, whether they be young infants needing intervention to mitigate the effects of developmental delays, children in preschool who benefit from both education and socialization experiences, school-aged children and young adults that need socialization training, or adults of all ages up through retirement age. On behalf of the almost 30 adult Palo Alto residents, the adults that Abilities United has the pleasure of serving, I want to thank you for your very generous and needed financial support. In total, we serve over 300 participants in adult services alone, and the costs have gone up while our state revenue has not kept pace. It is support from places like the City of Palo Alto that enables us to continue to provide the high quality of services that these people deserve. If we were not able to provide the services that we do, such as an independent living skills, adult day program, community connections, computer training, tailored day services, employment services, and the art program, these people would be sitting at home without without having a quality of life that they really should have. It is such a joy to see when I go in each day to the day program, these people come up and they literally can't wait to give me a hug and say thank you. Every day, this one particular gentleman from Palo Alto says, Roger, thank you. This is the best time of my life. Thank you so much. And I hear it every day, but I never get tired of hearing it. These people experience the opportunity to enjoy what this community offers, a fantastic community, but also have the opportunity to give back by doing volunteer work. And also, as a result of the assistance they receive, they're able to get jobs and give back to this community. And from the bottom of my heart, and all the rest of us of Abilities United, I want to say thank you.
Do you have summer camps for the
we do have a summer day camp for some of the young people, but actually we have day camp every day.
Every day.
Every day we got day camp.
Thank you so much
It's
for your
my
commitment.
joy. Thank you, sir.
Thank you.
All right.
Alice Turner and Sharon Hudson. Why don't you come sit at the table, because there's two of you, and maybe that would help us with respect to...
I'm leaving my guide.
Sure. Yeah, we have a microphone the two of you can share.
Thank you for that. Great, excellent.
And just introduce yourselves and your connection.
Got it. Hello, my name is Alice Turner, and I'm the Community Relations Manager for Vista Center for the Blind and Visually Impaired. First and foremost, I want to thank this commission and for your support over the years. The funding that you have provided us really helps us in being able to leverage and get additional funding. What we do is that we create safe and healthy living for our clients. And so what this grant is designed to do is to be able to provide that support for seniors living in Palo Alto, seniors who are visually impaired or blind. Last year, we provided this program to 77 seniors living in Palo Alto. We expect to provide this for 95 individuals. What does safe and healthy living look like for us? It means having the opportunity and the ability to be able to perform all of the tasks of life. So how do folks cross the streets? Our office is located at El Camino and California Avenue. If you can picture yourself standing there and crossing that street.
I tried to recently. That's a very difficult street to cross right there.
Absolutely, absolutely. Yeah. And so what we do in that Safe and Healthy Living program is that the individuals that come to us, the residents of Palo Alto and the other 3,000 individuals that we serve, they come and we help to retool them, not only in the skills and the proficiencies, but emotionally as well. Isolation is profound for people that are blind or visually impaired. So what we want to be able to do is to have them out in the community. We want them voting. We want them working. We want them seeing their grandchildren. And so what that means is being able to organize their life and be able to live a happy and independent life.
Now, you had the opportunity, I think, once to visit with us separately, and I remember you handed out a little card for signature in which there is a little cutout.
Yes.
And I provided that to someone at our church who was blind, and
Excellent.
he put it in his wallet, and he was very grateful. So there are some
there's low tech and
strategies.
high tech. Absolutely.
Right.
So signature guides as well as my iPhone that's in my pocket that talks to me all the time.
That's wonderful.
Yes.
Sharon, thank you for making the trip. And
hi, I'm Sharon Hudson. I'm the associate
we didn't
director.
establish that
That's
if
okay.
you bring two people, you could have 4 minutes. But
No.
I guess that's how we'll do
no.
it. So go right ahead.
Yeah. Actually, she misspoke. We saw 77 people last year, 95 this year. So it's a growing population, the visually impaired, because of vision loss being, as we age. It's basically an age-related disability for many people, and it's also growing for those because diabetes and such. There are certain diseases where it's much more prevalent. And just one of the things I wanted to say, I know one of the things we try to do is reach out to, we serve all communities, all people, and if there's somebody who needs the service, we're happy to serve them, regardless of whether they speak a different language or whatever. We will get interpreters in and all. And I was just looking at the different languages last year. Just for Palo Alto, Chinese, Farsi, French, German, Hindi, Russian, Spanish. So we got translators in to help with reaching all the different communities. And 80% of our clients are low income, according to HUD. So despite Palo Alto having the regular population being higher, our population, they really are in the low income section. So thank you.
Well, we hope you felt welcome tonight, and we welcome you back again.
Thank you.
Please give us a progress report, and thank you for your commitment.
Thank you very much for supporting us.
Okay. Philip Ray.
So I think if I may interject.
I'm sorry.
Yeah, I think we have a mom with 2 kids, so we should prioritize her, and then, you know, if they want to
Okay,
go
Philip,
on.
can you hold off just a second? Okay.
Dominique from Blossom first.
Dominique, won't you come up? Bring the children. It's okay. Bring them on up if they'd like to come. There's some chairs right here, guys. You sit right here.
You guys can sit there.
There's a chair right here. You sit next to Commissioner Lee. He's friendly. He's okay. All right, go right ahead, please.
Good evening. Thank you for having me here. I'm Dominique Vincent. I'm the Executive Director at Blossom Birth and Family here in Palo Alto. These are my 2 children, Vivian and Adriel. My husband is traveling on business, and so this is life. I wanted to thank you for the opportunity to get up in front of you, and I was disheartened and sad to see that we weren't receiving any recommendation for funding. But I just wanted to explain a little bit why I think it's so very vital that Blossom does get funding for this postpartum moods and challenges group that meets. You know, we've been serving families here in Palo Alto for almost 20 years, and we're located now on the corner of California Avenue and Birch, and we serve a very vulnerable population, people who are going through extreme life changes, things that will change their life for the next 20 years at a minimum, but generally for the rest of their life. And it's a very vulnerable time. And this program specifically, Postpartum Moods and Challenges, services folks who are experiencing mental health issues. About 1 in 5 women will experience perinatal mood disorders, ranging from anxiety, OCD, depression, and even psychosis. And one of the reasons I did want to mention and bring this up is that even one of our families in the area was affected by this year. I'm not sure how many of you are familiar with Kyle Hart, but it was in the news a few months ago. His wife is one of the families that came through Blossom, and unfortunately he lost his life 3 days after his child was born. And so this is a very, very serious thing that we're trying to prevent from happening. And while it looks like we don't serve very many people, the people that we are serving are vital. And reaching, with your funding, we could potentially double the amount of families that we're able to serve and reach families who don't have the funds to actually come and be served during a very vulnerable time of their life. So
Well, it's very interesting.
I think that's all I wanted to say. Thank you.
I want to thank you for your passion. I just want to let you know that there isn't a final decision yet, and the subcommittee vote was 2-1, so it was not unanimous on Blossom. And we had a lot of good input from staff on your organization. I think all of us unanimously recognize the good work that you're doing and the importance of it. So thank you for coming in, and we appreciate you.
Thank you. I have to get my kids home to bed, so.
Okay. Thanks so much. Philip, ready to go?
Good evening. I'm Dr. Philip Ray. I'm the Executive Director of Adolescent Counseling Services, and I've been with the organization since 1998. And as an organization, we've been providing services to the Palo Alto community since 1977. We estimate we have helped over 85,000 youth and family members since then. Just to give you some information, it is a reality that our teens are currently going through a lot of struggles. 1 out of 5 adolescents in the United States and locally suffer from a major mental illness. And what's really sad is that only 30% of those receive any type of treatment or support. So there are 70% of youth just left on their own to make it into adulthood. 70%, this is from the Pew Research Center. This is a brand new research that came out 2 weeks ago. 70% of teens in the United States report feeling depressed or anxious at all times. This is a huge increase from years past. Suicide is, as you know, the second leading cause of death in youth aged 10 to 24. And then the substance abuse is on the rise. So at our substance abuse treatment program, we are seeing an increase in the use of marijuana. Alcohol is actually decreasing, but here's the thing, that in about 3 years, you will be hearing me screaming and rioting in the street. We have an epidemic on our doors, and this is the vaping and the nicotine addiction. It's a huge problem. We're only seeing the tip of the iceberg. We're seeing it in middle school. If you remember back in the 70s, 80s, we used to say that marijuana was the gateway to harder drugs. Watch my words, vaping is the gateway to drugs in our youth nowadays. We need to do something, and Adolescent Counseling Services, with our substance abuse treatment program, is the only organization of its kind that can tackle and handle this epidemic. In terms of our LGBTQ plus youth, in our program, 60% of our youth coming to us for support report that they feel unsafe in our local schools, and 40% of our youth say that they live in a hostile home environment, thus increasing the chance for homelessness. So just knowing all those stats and what's really going on with the youth, we know there is a need for an increase after-school support for youth in Palo Alto. So through our offices, our 5 offices on Grant Avenue, plus with the relationship that we have with the local schools, including the Palo Alto Unified School District, we would love to serve, through our proposal, 1,000 youth each year. This is an increase from what we're doing. And basically, if you look at it, $100,000 per year for 1,000 youth, that comes down to $100 per youth. This is really cheap to save a life. And I really appreciate all the help and the support, financial support that you've given ACS since 1977 as part of the HRC and Palo Alto City Council, but I would like to also propose if there would be any way for an increase in the support. As I said, you'll hear me back 2 years ago saying we need more support, especially with the drug epidemic, the vaping, and also with depression and suicide, specifically after school. I mean, we have wonderful organizations like Cassie that provide the services at the school during school hours. After 3:30, where do those kids go? There need to be increased services, and here we are right here on Grant Avenue, 5 offices plus our other offices in San Mateo, Santa Clara County. So I would like to request for a second look at the support.
Sure.
And this
And
would bring
let me
us.
just ask a question. Were you part of the LGBTQ summit that the Human Relations Commission held?
Yes, absolutely.
Okay, so that's great, because Commissioner Lee and Commissioner Stinger were spearheading that this past week, and it was a wonderful gathering of folks who were concerned about the same things.
Yeah.
Thank you for coming tonight. We
Thank you.
really appreciate it.
I appreciate it.
Okay. Ryan Fouts? Ryan, thank you. Welcome.
Thank you to the HRC for this discussion tonight and for your historical support of Outlet and ACS. So to introduce myself, my name is Ryan. I'm a licensed clinical social worker, and I'm the program director of Outlet. So as you may know, Outlet is the only program providing specialized services to LGBTQ plus youth in this area. One thing that I want to add to what Philippe said is that I want to highlight a recent report from the Horizons Foundation that found that last year in 2018, 34% of the LGBTQ individuals in the Bay Area were unable to access at least one vital service, such as mental health support or substance use treatment. And again, that was just released based on 2018 information. Outlet is committed to supporting Palo Alto's LGBTQ+ youth community. In this fiscal year alone, we've deepened our support within the Palo Alto School District and have greatly increased our provision of school-based and district-wide consultations and trainings, ranging all the way from the elementary schools up through to the high schools. In fact, just last night, we were part of a parent education night at Fletcher Middle School that brought out nearly 70 community members. As you just referenced earlier this week, I was part of the LGBTQ Working Summit with other community providers, where the need for increased training about our community and the need for specialized mental health support, as well as the need for a designated community space for LGBTQ members, were all voiced. In addition, right now we're in communication with local universities to pilot research studies that are going to help us better detail the needs of LGBTQ+ youth. Outlet seeks to expand our reach within Palo Alto so that we can support even more young people. Our vision is that no youth in this community would experience shame and rejection for who they are, but instead that all youth would end up succeeding and becoming happy, healthy, productive members of our community. And thank you for your commitment and your support for our processes.
Just wondered if you could give a little bit of feedback. San Mateo has an LGBTQ center.
Yes, they do.
And you mentioned space. Is that something that you're thinking about right now?
There was a large discussion at the commission, or at the working summit earlier this week, that there, especially within northern Santa Clara County, there is not a designated space where LGBTQ community members can go.
And do you think that the San Mateo one works well?
I do. Yeah, having a designated space where community members know that they're safe and they're welcomed is absolutely vital. And for Santa Clara County, the option at this point is either to go north to San Mateo or to go south to San Jose. So I think definitely finding ways to bring a designated space to northern Santa Clara County is absolutely vital to increase support, not only for LGBTQ youth, but really LGBTQ individuals across the lifespan.
Great. Thank you for your commitment.
Sure. Thank you.
Okay. Michelle Schroeder. Michelle, good evening. Thank you for being here.
Thank you for the opportunity to address you. I am the supervising attorney at SALA. I've been with the organization for 24 years. SALA is a nonprofit office that provides free legal services to senior citizens. We provide our services countywide and in Palo Alto. In Palo Alto, we offer half-an-hour appointments at the Avenida Senior Center and also at Stevenson House. Last year, 71% of the Palo Alto seniors we served were very low income. 56% were 75 or older, and 21% had a disability. At SALA, we see seniors with legal problems involving the public benefits they rely on to meet basic needs. These are benefits such as Social Security, SSI, Medicare, Medi-Cal. We see seniors that are facing eviction, seniors that are the victims of elder abuse, very often by someone living in their homes or by someone that they know. Seniors that need to do basic planning for incapacity, and seniors that need legal advice about where to go and what to do with other matters. Without SALA, most of our clients would not be able to navigate the legal or public benefit systems, represent themselves in court or at benefit appeals, prepare legal planning documents such as powers of attorney, or to know where to go or what to do about other legal matters. SALA cannot charge fees for our services or accept fee-generating cases. The primary way we support our services is through government grants, such as HISRAP. We hope that the HRC will support the review committee's recommendation for funding, and we want to thank you again for your support of SALA.
Quick question. How do you define senior citizens? Is that 55?
Yeah, hold on just a second. We don't have a public ability to have public questions, but I will ask that question because I understand your interest. And I guess I have an interest to know when I can stop by your office. How soon?
Well, for our program, it's 60 and over.
60 and over. I've got a few years. Okay. All right. Thank you. And
Thank
thank you
you
for your commitment to the community.
Oh, my pleasure.
Really appreciate you being here. Maureen Damrell. Maureen, are you here? Again, yes. Okay. Did you fill out 2 cards? Is that how you did it?
I may have. Hi.
Yeah.
Long time no see. Yes, I did fill out 2 cards.
That's kind of you. Thank you.
Well, I thought I had to, so perfect. I want to say first that I'm very inspired by what everybody's doing to serve our community tonight. I think that there's so many really important things that people are doing. So thanks to the other service providers. It's very encouraging. So particularly through his rep, we Downtown Streets team is or has sought funding for outreach, case management, and that is also, it's a big connecting part to PAR Court or Palo Alto Review Court, as well as the resources that are offered with the Public Defender's Office at the Kirk Cumley Resource Center. It's enabled us to really connect for deeper into the community, maybe people that wouldn't show up to the Downtown Streets team meeting, but didn't realize what services we're able to connect them to. It's a nice way to engage more people. So I don't want to take up too much time, but I appreciate you guys considering our needs. I appreciate your support that you've already given us and hopefully continue to give us. So thank you.
Thank you for your commitment. Leif Erickson. Leif, are you here? Thank you so much for coming in tonight.
Thank you. I'm Leif Erickson, Executive Director of Youth Community Service, and want to thank the staff and the commissioners for your work on our proposal and your recommendations. I appreciate that. Appreciate also your past support for our work with the city and the community. We serve about 1,200 students each year. And middle school and high school students, and engage them in activities that lead to civic engagement, to a sense of belonging and connectedness in the community, sense of knowledge and understanding of community issues. Examples of recent activities, we partnered with the city for Martin Luther King Day, and there were hundreds of children and youth and families who participated in that day with a whole series of entertainment and learning activities about legacy of Dr. King and entertainment. And we another example was a recent Gun High School Service Day. There were over 300 young people who participated in that day, going off campus or on campus, involved in service projects. One of our favorite programs to volunteer with for high school students is Blossom Birth. And I'm particularly touched by the boys, some of these very tall, hulking high school boys who were volunteering with Blossom Birth. And it's very touching to see that. So shout out to Blossom Birth. So thank you for your support in past years. Our young people grow up to take roles in public service. One of our young people grew up and became mayor of Palo Alto. And who knows, maybe in the future we'll have some who will serve on the Human Relations Commission. So thank you.
Thank you very much for coming in. All right, Michelle Liu, CEO of the Health Trust. Michelle, welcome this evening. Thank you for your patience. We look forward to your comments on the Health Trust.
Good evening. My name is Michelle Liu. I'm the CEO of the Health Trust. I'm a Palo Alto native and a current resident of Palo Alto. The Health Trust might be new to the HRC, but we're not new in the community. We were founded in 1996, and since that time, we've been providing Meals on Wheels in the county. What I wanted to make sure you knew is that Meals on Wheels is not just the meal. It's also a daily wellness check by a driver who can check on the senior and make sure everything's okay at home, that they don't need extra help. If they do, our driver can make a call immediately and get in contact with that senior's loved one and make sure that they get the support they need. We have a first-time request in for $20,000. The recommendation is $10,000. We'll take 10,000 or 20. And I'm here to answer any questions you might have. Thank you.
Thank you very much, Michelle. Valerie Telma. Valerie, good evening. How are you?
Very good, thank you.
Thank you for your patience. Welcome to the commission.
Thank you very much for this opportunity to address the commission.
If you would just move the microphone
to the mic
closer.
right away. Hello, everyone. I'm Valérie Talma. I am a board member and the treasurer of La Comida. La Comida has been serving nutritious and affordable meals to the senior citizens of Palo Alto for over 45 years, 5 days a week. We are also the main contractor for the Santa Clara County Senior Nutrition Program. Last year, we served nearly 40,000 meals to seniors with just 4 full-time staff. And in addition to providing healthy and affordable meals, we provide senior, more importantly, with the opportunity to socialize, to meet friends, to feel welcome, to feel valued, which is crucial for their health and their well-being. I would like to share one very brief anecdote. One day I was serving lunch and I was talking to an elderly lady next to me. And she was telling me that she grew up in Palo Alto and that she's been living here for decades, 40 years more. And what was, when she started a very small house, became a multi-million-dollar house now. But she still comes to La Comida every day or very often because that's the only place where she can feel the warmth and the social community. And then I turned to the lady to the other side and I said, do you also live here? She said, yes, I live around here. I live in my car around here. So at the same table, this lady that would never meet or interact otherwise, and I think this is magical and unique. 2019 is a critical year for us. We are doubling down. We are opening a new serving location, La Comida downtown on Florence and University, a few steps away from here, because of the increasing need of the increasing elderly population in Palo Alto. So this is a very big financial commitment for us. We are funding it through fundraising, an aggressive fundraising campaign. We're funding it through our own resources, and we very much appreciate your support and your help as you have done for many years. Thank you very much.
Thank you, Valerie. We appreciate you coming in tonight.
Thank you.
Yeah, congratulations on the new center.
Thank you very much. And we'd like to see you soon and welcome you there when we celebrate our opening.
Jonak Bose, is that right? Chanaki. Good evening. Welcome.
So I'm Janaki Bose. I'm the new executive director for Dreamcatchers, and I just wanted to say thank you for your support. For those, I'm sure most of you know, but it's a free after-school program serving 65-plus low-income Palo Alto Unified. So it's only for Palo Alto Unified school students. Over 100 volunteers, tutor from Palo, Gun, Stanford, and there's a small staff that kind of helps connect the school day and aligns the school day with the curriculum that the tutors work with the students after school. We pair each student with their own personalized tutor, create an individualized program for each student, and align our program, as I said, with the school curriculum. And we try to build bridges by empowering local high school students with help with others in their own community. So that's what we've been doing, and wanted to thank you for your support.
And based on the recommendation of the subcommittee, you're doing it well, so thank you.
Yeah, we're trying to build a safe place.
We're going to turn to discussion and consideration of the review committee's
There's one more
recommendation.
card, Chair.
Oh, there's one more card, but this is not from an applicant, right?
No, it's a member of the public, so it's during oral communications. This is oral communications, so it's
Okay, very well, sure.
It's the gentleman right there. Sir, it's your time.
Thank you.
Just tell us your name. I didn't pick it up from here.
Drake A. Mitchell.
Drake, good evening, and welcome to the commission.
Thank you so much. I hail from the East Coast originally, my college days, Boston. I wish I'd gone to Harvard like my high school buddy John. Instead, I went down the street where they say either, I'll leave the old joke behind, but I went to MIT, loved robot languages. Seem to be coming back around to that. Sometimes it helps to plant seeds a long time ago, and then you find 20, 30 years down the road, Seattle all of a sudden really needs robot language contractors. My 90 seconds that I asked for tonight, I wish to address a contractor perspective on tonight's agenda topic. Resource allocation right now, the contractor community that I'm familiar with likes to drink coffee between 5 and 6 a.m. at a local Starbucks or a Pete's. We like to network before the 9 a.m. rush hour, all that madness rolls up. We're very intrigued by CAL FIRE's declaration of 94,000 acres of deadwood, preferably cleared by the end of the summer. There are some established contractors like McGuire and other landscaping companies that are looking to clean up probably, I'm just going to guess, between $1 million and $10 million of cordwood sold by the end of October. If we clear 94,000 acres of deadwood, CAL FIRE will probably experience a 40 to 80% reduction in wildfire hazard measured by deadwood that hasn't been cleared from typical civilian dwellings in foresty areas. I'm trying to spearhead an event, a PAO event, that might lead to 19 seconds of coverage on an evening news sometime in the next 2 weeks. Station 6, Menlo Park Fire Department, has a very photogenic location. We expect our battalion chief to break down the opportunity in probably a less than 9-minute event that might get coverage by NBC. Thank you.
Thank you for coming in. Appreciate your patience. We are presently in item 2C, discussion and consideration of the review committee's recommendations. Other commissioners that would like to ask questions of the review committee and or staff. Commissioner Lee.
I don't have any questions, but I do have a comment after we finish questions.
Any other questions, Commissioner Stinger?
Frame this as a question. Could you talk more about your review of Ada's Cafe's proposal? You did mention it. Is there more that you'd like to detail, or you said the staff also looked at the proposal and the applicant? Is there more detail?
Well, there were some deficiencies in the application. It was inaccurate, and the budget was not correct, and we had to kind of go back to them for clarification. And they admitted that they're suffering a shortfall, and that's a little bit problematic from his RAP perspective, because one of our requirements is we have to fund agencies that are sustainable. We're not really supposed to bail out people who aren't doing well, because then the city's money could go down the drain. And so that's part of the stewardship that we take on. But looking at all things considered and the length of time ADAS has been in the community, and the good work that they're doing, we did eventually agree that we thought that a small initial grant would work for them.
Thank you.
Any further questions, Commissioner Brumbaugh?
I have no questions.
Okay. Without further questions and discussion, we'll move to the recommendation. I'm very sorry, Stephen.
No, I didn't have a question, but if we're moving to discussion.
The light went on. Okay, sure, go ahead.
So if we're moving to discussion, then I'd like to speak first if I could, but if you
Please, go right ahead.
So I really appreciate the work that the his RAP committee did. I took a look at all of the applications myself as well, and took a while to slog through them. I really only had the benefit of sort of talking through them with myself here. So, as I was going through in my mind, sort of what are the big needs in our community, I think all of these agencies certainly serve one of those needs, right? I mean, they all fulfill one of the items on our list of priority needs. But two needs in particular really stand out for me as the biggest needs. One of them is mental health services, both for youth but also for the entire community. I was particularly struck by the most recent national citizen survey that the city did. And they found in this past year that the percentage of Palo Altans who rate the availability of affordable quality mental health care as excellent or good, it went from 52% last year, or in 2017, to 38% in 2018. So that number is not surprising given all that we are seeing sort of anecdotally and in our everyday experience in Palo Alto. So to me, mental health is the number one issue, the number one human service need in Palo Alto. I think the other one is homelessness. We see it downtown, we see it all over the place. A lot of our fellow citizens mentioned homelessness as something that they wanted to see our city do better. Something that one thing that they wanted the city to make happen was to address homelessness. That was on one of the lists in the survey. And so as I was thinking about our funding recommendations through that lens, I would encourage the commission to consider directing more money to those agencies. And so I do have I hate to call it an alternative recommendation, but a recommendation that I came up with for discussion purposes to see where if the commission may entertain it. As a base, it would, maybe I should just pass it out. As a base, it would maintain the funding for all of the agencies at the levels that they had received in the previous funding cycle. So that was sort of the floor for me, given the good work that the committee did in ensuring that the applicants were performing. That gave me...
Take a moment and you're going to show it on the screen, right?
Yeah, that gave me some reassurance that those agencies are doing good work and that their funding should be maintained for stability purposes and to help them keep doing what they're doing. Hold on one second. So those are the ones in yellow. We would under my recommendation, we would maintain funding at previous levels. The green, light green, reflects sort of an increase from what they received in the prior cycle. In the case of
ADA's
that they didn't get any, so that's an increase from 0. The blue are the fully funded agencies, and then the dark green are sort of dark green except for this one. This one was supposed to be a light green. The dark green are larger increases than what is recommended by the committee.
That's not true in the case of Mayview. You recommended less.
Your microphone is off.
You recommended less, we recommended more.
Sorry, correction. So the green is a increase from what they received in previous years.
Yeah, maybe the best thing to do, Commissioner Lee, is just take one at a time.
Sure.
Because if we try to, describe it, it will be difficult.
Yeah.
Okay?
So the bulk of my recommendation you can see here is with regards to adolescent counseling services. Again, I think they do fantastic work, and I think mental health, in particular, as it addresses our youth and the LGBTQ community, is the priority for me. And so my recommendation would be that we bump them up to, I had 80,000 here, but actually in light of recent discussion, I'd be inclined to put 5,000 towards Blossom Birth and bump it up to 75,000 from the committee's recommendation of 42.5. That's sort of the bulk of the adjustment. There's an additional adjustment for life moves from the committee's recommendation of 78, almost 79 to 85. Yeah, so I think I will leave that there and solicit thoughts from my colleagues in the commission.
It might be easier I'm just trying to think how to work this because the subcommittee's recommendation was the recommendation on the floor. I'm not sure if you want to start with that and then bring other aspects if people are interested in Commissioner Lee's alternatives into it, but I'm just thinking of process-wise if the subcommittee wants to bring their motion to the floor and then kind of work from there, instead of starting with Commissioner Lee's as the starting point. I'm just seeing where the chair would like to do that.
Yeah, no, I'd like to talk about his proposal.
Okay.
And I will ask some questions about it. You identified a couple of priorities for your proposal, Commissioner Lee.
Mm-hmm.
And the first one was mental health. I just wondered if you could speak to the increases in mental health funding over the subcommittee's recommendation. Just the mental health funding first.
Sure.
And identify it within your chart, okay?
So the first one is ACS. So I will give the committee kudos for recommending ACS get a larger increase than the other agencies, so I really do applaud that there. But under my recommendation, we would bump them up to 75,000.
It says 80 here in mine.
Yeah, I just made an adjustment based on some comments I heard during the meeting. I would take 5 from my 80 and put that towards Blossom Birth.
Okay,
So
great.
if you can just change that number on your sheet to 75.
And then 5 to
5,000.
Blossom Birth, under the theory that Blossom is addressing mental health needs, is that right?
I didn't necessarily do it because of mental health, but I thought it was, I'd like to encourage new agencies to apply, and I think it's worthy of at least a minimum funding.
Okay, is there another entry in which you increased the funding for mental health?
Yes. Cassie here, so the committee that's the blue one, recommended 42.5. I would maximize it to 50,000.
Okay. Any others that relate to mental health?
So momentum, I put that at 33, which is a decrease from the committee's recommendation, but still I increase.
Momentum is
Momentum's
no
not
longer a funding
sorry.
application.
What is that one?
Mayview.
Okay, sorry. But never mind, that's not a mental health one.
No, Mayview is a mental health one.
They do, they do both mental health and primary medicine or.
And now they're going to do dental as well.
Yeah. Given that mix, I'm not recommending any.
More than 50% of their clients get mental health services.
Okay, if we could just go to the second broad priority that you had.
Was homelessness, so that was
Right.
primarily an adjustment to life moves from 78.9 to 85,000.
Okay, and any others related to homelessness?
Not seeing them on let's see.
Looks like downtown.
Well, DST is already fully funded under the committee's recommendation, so that would be the same.
Okay,
Not seeing any other ones here.
all right.
Yep.
Let's entertain discussion on those identified changes. Would any commissioner like to ask any questions about those changes or discuss them?
Yes, I would like to discuss them. I strongly disagree with my colleague's analysis. I agree that mental health and I agree that homelessness are two huge problems in the community, but I also believe that food insecurity is the predominant need. People who are hungry and malnourished cannot avail themselves of other services. Food is the gateway. Sir, excuse me. Food programs are absolutely essential to life. Without life, we can't go ahead and provide additional physical and mental health services. So I disagree strongly. I think we need to continue to prioritize food-based and nutritional programs for all ages, and particularly our most vulnerable people, who include seniors, who include low-income families, children, and homeless individuals. And having prioritized those, I think then we should look at allocating, and the current allocations that the subcommittee came up with do then focus heavily on both homelessness and mental health. So I think we have a better distribution and a better allocation in terms of our recommendations than what Commissioner Lee has proposed.
Well, let me just comment on that discussion and just say this, that not all of us had this number that's on the right-hand side. And I looked back into my own thought process, and being a mental health hearing officer, I also prioritized mental health and had higher numbers. But there was a discussion and an attempt to reach consensus. One of the things that I remember from that discussion is that, as an example, ACS had a contract amount of 10,000, and we had quadrupled it to 42,000. So that was a huge increase. And some of the analysis that was brought forward was, how to track and make sure that this huge increase is being used not only properly but used effectively. There were competing services with that. The CASI service, which in large part was increased, and that also had a fairly big increase. That was another service that we were trying to grapple with at the time, and I see that you've accepted their recommendation of 50, but you did not accept the recommendation for 100. So, in some sense, it's kind of hard to reach a consensus. And I want to acknowledge an argument that was made by Commissioner Onan, which is, a focus on frontline food and security, which in large part does deal with homelessness, which is the second of your priorities. So I would like to also say to Commissioner Lee that I agree with you on the 5,000 recommendation on Blossom Birth. It was a 2-to-1 vote. And I would be open to trying to fund them to that level. What we did was we actually went back to Blossom and we acknowledged their program, insofar as its reach to Palo Alto residents, did not meet the threshold level that was required for funding of $5,000. And we also looked at, what was the amount of money that the proposed patients or clients would, make. And I think there was some sense that that might not fit with the overall purpose of his rep, which was another discussion. So I do think I'd like to ask Commissioner Hsu to give his viewpoint about whether the subcommittee addressed mental health and homelessness as priorities.
I do. Sorry. I do believe so. We have, as we are facing an aging community, mental health, also, the food need, disability. We heard a lot from different groups. We only got this much resource. If we, allocate big chunk of money to, very specific program, it's very hard to support, service our community. We had, very lengthy meetings for 2 evenings. So 3 of us plus the staffs. So basically, based on the application, we, did a lot homework. Also, the staff visited their sites. They answered our questions. I feel, the proposal is quite fair. So even after hear Blossom Birth talk, I'm still not supporting to give funding them 5,000. So I want to see they can serve more clients from Palo Alto.
And if I'm right, the universal view of the subcommittee was that they're doing good work and that we would like to see them come back at a later time because the number of Palo Altans served in the community might increase because of their continued for this program, for their continued work. And that was something that I know they have a lot of staff contacts who will keep us apprised of that. Go right ahead.
Unless anyone else has anything to say, I would make the motion to accept the proposal on the screen.
Is there a second?
Yeah, I can second that.
Okay, and do we have any discussion? Commissioner Brumbaugh, would you like to give your viewpoint?
Yeah, I mean, I think giving nothing to Blossom Birth doesn't seem fair. You know, I think instead of 5K, if we could get it from somewhere else, I would increase it to 10K.
We can't do, they don't serve enough people to justify that much.
Well, you have to use your microphone.
Cannot do that.
You have to use your microphone.
Oh, I'm sorry, we literally cannot do that because the money can only be used for Palo Alto residents and they don't serve enough Palo Alto residents to justify that size of a grant. We cannot spend the money on non-Palo Alto people. It's against the rules.
So are they serving?
They're not even serving 5,000 worth yet.
But when I read this summer,
Hold on, Commissioner.
Yeah, I mean, I think I heard different things because you said they are serving people who are earning more than 100K. And so they are not serving people who are like poor enough. And now you're saying they're not serving people from Palo Alto.
There were two issues. They're not serving enough Palo Alto people to justify even the minimum $5,000 grant.
Yeah.
And the demographic they're serving makes over $100,000 a year. So both of those things are somewhat antithetical to the purpose of his route.
could I ask a question? I thought in my notes that they served 60 Palo Alto residents.
It was 30. 30 was the amount of resident. That might have been a 2-year total. I can look back at the grant, but when we did the allocations, they are they would be serving their projected total for 2019 was 132 clients, 30 of which would be Palo Alto residents. And so that's 23% of the total amount of clients that they serve.
Yeah, I mean, I just want to say as a family with a newborn baby, I think that's one of the most challenging times you experience, and if somebody, that's the only category that is supporting. Supporting that, and as long as it's Santa Clara. I mean, I have received requests from the school community for very rich families who have had newborns who need support. It doesn't matter whether you are rich or not. When you are going through that transition where you're supporting a newborn, you need all the help you can.
Right. So the funding is
get.
for scholarships for folks. So the funding is not to offer it for free. It's the funding is to provide scholarships for Palo Alto residents for the program. So the money would go directly toward reducing the cost of the program for Palo Alto residents. It's $20 an hour now, and it would reduce it to $10 an hour. So that's what they're requesting city funding to do.
Commissioner Stinger.
I lost you there. Why is it per hour? Like, why the 10 to 22? What is the per?
So they're asking for support for their postpartum birth support group.
Yeah.
So so they're asking for support for people to be able to participate in the group that now they feel there's a barrier to them providing because of the cost of the program. So the full cost of the program is for a participant is $20 an hour. So they're asking for the HISRAP funding to be able to support moms to participate in the program for $10. So there'd be so the HISRAP funding would pay 50% of that mom's ability to participate, and then the mom would pay 50% of the program to be able to participate in the program.
Shouldn't it be free? I mean, why does the mom have to pay 50%?
That's up to Blossom Birth to designate the fees for their program.
Yeah, I mean, in any event, I support the 5 or 10K or whatever we can. In the
Okay,
motion.
the proposal
I'm
on
not
the-
comfortable with not giving them anything.
Yeah, the proposal
Yeah.
on the table is 5.
Yeah, then
Okay,
I support
sure.
that.
Commissioner Stinger, you had a
Can I
comment?
ask clarification? So was the proposal that moved, was that the Commissioner Lee's proposal or the subcommittee's proposal?
No, it's the Commissioner Lee's proposal,
On the screen.
Okay.
with a change.
Commissioner Lee has modified his proposal.
Right, it goes from,
It's on
yeah,
the current
ACS
screen.
is now at 75, and Blossom is at 5,000. That's his proposal. Okay, Commissioner Stinger, you had your light on, please.
I wanted to think out loud, because there's a lot of numbers in these columns. I first want to thank the subcommittee, the team that put this together. I think it's a lot of work. And I also want to thank the speakers who came, because it's just really enlightening to hear their commitment to their purpose and their mission. And I want to encourage anybody who did not receive funding or who did not receive the level of funding to come back again, because each exposure we have helps us evaluate that more. And I want to thank you, Commissioner Lee, because I think it's interesting to see that the range of possibilities. And I think this is really helpful for me to sort of kick the tires and challenge each of these proposals. I think overall, I might have, I'm afraid after, what would you say, 6 hours you spent in your 2 meetings? And I know you spent a lot of time too, but I hesitate to juggle with numbers too quickly. Because there's so much thought going into the subcommittee's proposals. But I do see some places where I think some line items that deserve some thought. Blossom Birth would be one. ADAs would be another. And I appreciate your answer that the application did not meet your standards. I thought it was loosely written. Also, and the issues that I see in the press that they're facing are not the issues that they addressed in the proposal. So I don't know, so I understand the questions of sustainability. But I also see that there's just not, when I look at the special needs that they would be part of, there's not much funding in that area. It's Abilities United and ADAs. And if we don't fund ADAs, I feel that we're missing an opportunity to provide employment and training for disabled people, for disabled students, and high school students to work with that community.
Well, the ADA's application, just to clarify, was for their executive salary. So, and that person in turn was going to provide services, but it was to cover an operational shortfall. And that really is very problematic, because the city's money cannot be used to shore up an agency that doesn't have a sustainable business model.
Thank you for the clarification. As it's written, I have trouble accepting this, but I do think that there's some things we can learn from this. The funding for adolescent counseling services and Blossom Birth being 2 areas.
Commissioner Lee.
I hear what my colleagues are saying, in particular about, I want to be respectful of the committee's significant effort. Certainly the, CDBG committee, we didn't meet quite as much as the HISREP committee, but I'm sure I would have some bruised egos if an alternative was proposed. But I think it's important that we, really think about this carefully, and not to suggest that the HISREP committee didn't. I really appreciate that the HISREP committee did give a significant increase to ACS and others, so I do want to acknowledge that. I just think that we need to see an even larger increase given what I and a lot of people in the community think is the issue, and I think that there's obviously going to be, we're going to have to agree to disagree on what that is. If we go sort of line by line, we can see that, even though ACS has a bigger increase under my proposal, the other ones have very small modifications, and it's when you add those small modifications up that it enables us to increase ACS so significantly. So Abilities United, again, funding them at the same level as 2019, it's about a 6,000, it's 45.8 versus 51 recommended by the committee. ADAS is the same. CASI is bumped up to 50 from 42.5, so maybe a slightly bigger increase there. DST is the same. Dreamcatchers is the same. CARA is the same as last year. It's only about 2,000, 3,000 short of the committee's recommendation. La Comida, that I would admit is a bit of a change there from 46 to 37. Right. Life Moves is a 7,000 increase. Mayview is just a 7,000 decrease from the committee's recommendation. PAH is within 5,000. Sala is essentially the same.
So if I could interject, though, to my colleague, keeping an agency the same is, in effect, giving them a deficit, because the cost of living is astronomical
Sure.
here in the Bay Area. So these modest increases are, in effect, a cost of living increase for the agency. And without them, the agencies will do less, and they will serve fewer people. So we may feel like we're not causing them any burden by keeping them at the same level, but in fact, we are degrading their ability to perform.
I understand that, and I appreciate that comment. Again, I in the priority of needs in my head, I have allocated accordingly to what I believe are the greatest needs. Again, all of these serve important needs, but there are some that I think are greater needs.
So is there like a 10%, 20% increase, decrease scenarios not needed for his rep?
There's nothing needed, yeah. Commissioner Shu, any thoughts?
So this is like the 712 is the requested and 515 is what is going to be there. It's like final.
That's correct. That's it. That's in the proposed city budget for the next fiscal year.
Okay. So
Commissioners-
the city has proposed 515?
Yeah, yes, that's true. For the next year's proposed budget.
Okay.
Commissioner Stinger, if I could just ask you, when you made a statement that you had some issues with the proposal, was that with the proposal of Commissioner Lee that's on the table and motioned? Or is it with the other proposal, and what were those issues?
I was speaking to the motion that's on the table, so that would be Commissioner Lee's.
So you
And
would
I
have
see-
issue with something, and
And
could
the issue that I have is mostly not methodology. I'm blanking on the noun that I want.
Priority?
No, respect for the work that the careful juggling that the subcommittee did.
Deference?
I don't
is that
want
the
to.
word?
Thank you.
Deference to that.
I don't want to walk away from a carefully thought-out proposal from the subcommittee, but I also see some advantages. But I think whatever proposal we put, we would see pluses and minuses to that committee, the individual, personal preferences. I mean, if I put my numbers here, I'm sure I could make a good case for my numbers. You said your committee voted 2-1 on some of these. You could probably make a good case. It's the totality of column 4 of the subcommittee, of the HISRAP subcommittee, that it's a delicate balance, and I want to respect that. And that's painful because I also respect the priorities that you set. So it's a...
If I can say something, and I mean it with all due respect, so I'll try to tread carefully. You know, I've served on other human relations and social services commissions in other cities, and we have very similar funding recommendations that we do. Palo Alto is unique in the sense that our commission has decided to delegate a bulk of the work to a subcommittee. When I've done CDBG and other similar funding on other commissions, the entire commission had a chance to weigh in, really deliberate it in greater detail, ask a lot of questions. And so, you know, while I do want to respect the hard work done by the committee, I don't want to entirely defer to that committee. In making my proposal, I relied heavily on the work that the committee did in terms of judging which agencies, how agencies have been performing. And so that sort of led me to the ones in yellow, gave me the confidence that yes, we should at least, at minimum, fund them at the same level of previous years. But again, it came down to sort of my hierarchy of priorities in my head. We have limited funds, and while we would love to fund all of them, we'd like to fund all of them closer to the amount that they requested. And maybe that's something that the commission recommends to the council in future years, that we see an increase. It looks like the amount allocated this year is the same as the last 2 years, so certainly it hasn't kept up with inflation. So that's something I'd like us to perhaps weigh in on later. But given the finite pool of money as it is, and what I'm seeing in the numbers from the survey, and what I'm hearing from folks in the community, I think the allocation as I laid out in my mind reflects that. Again, not diminishing the work at all that the committee has done, but really building upon it and using it to help build my case on. So.
And I would like to respond to my colleague. I appreciate that he's heard from the community, but I imagine that what he's done is talk to people at the school district. He's talked to parents who are very concerned about their kids. He's talked to kids who are struggling, and he's heard in a very bona fide way about the needs of the community. But I warrant that he has not talked to a low-income senior who is hungry. I warrant that he has not talked to many, many homeless people who are hungry, or low-income families who are so off the radar that he would probably never encounter them unless he really sought them out through the partner agencies. Those are hundreds of people who live in this community, and they're largely invisible. So it's important not to wipe them out in terms of our funding allocation recommendations. We are the voice for those most vulnerable, most invisible part of Palo Alto, and we have to be true to them, and we have to make sure that their most basic biological needs, for example, for food, are met through HISRAP dollars, because that is the core of what HISRAP is intended to be.
So I wanted to suggest a proposal to the committees.
Well, we have a motion on the table, and it's been seconded, and that's what we're discussing.
No, I mean, as we are discussing that, I was wondering if you guys would think of moving the 5K from Ada's Cafe, given that the proposal was very problematic, to Blossom Birth. And then keep the rest of the numbers.
In fact, the subcommittee did consider that.
Okay.
A particular one. It was debated back and forth, going back and forth. But at this moment, Commissioner Lee has funded Blossom in his motion. So if there's any other further questions or discussions on the motion on the table, we're going to go ahead and take a vote.
But I mean, it's pretty clear that, anyways, I don't want to speculate on the vote, but we can take the vote.
Okay. So those in favor of the motion on the table, please say aye.
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 Those that are not in favor of the motion on the table, please say no.
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 Commissioner Stinger? I abstain. Okay. I'd like to ask Commissioner Onan to make a motion as to the subcommittee recommendation.
All right, thank you, Chair. So I'd like to make a resolution that the HRC approve the funding recommendation allocations as evidenced in the where is it, Minka? Attachment A? Yes. Attachment A is provided at places. And I urge my colleagues to accept this recommendation. It is never possible to be perfect in our recommendations, but I think we have done a good job in ensuring that all of the agencies who work with our diverse population can do the work that they do so well and continue to do it effectively in the next funding cycle.
Is there a second for the motion?
Second.
Okay, discussion. Anyone would like to?
Yeah, so I would like to hear more about the subcommittee discussion of moving the 5K to the Blossom Birth and why it was decided one way or the other. The other thing was, I think...
Blossom Birth was a 2-to-1 vote. I was in favor of funding Blossom Birth. The other two commissioners on the subcommittee said no. In actuality, both were unfunded until we had some answers to questions about Ada's Cafe because of, I guess, information that was within the application that didn't seem correct, and we asked them to correct it and or to explain it. And I'll ask Commissioner Onan to supplement my comments.
All right, yes, thank you. So we took all of the applications very seriously. Both Ada's and Blossom Birth had deficiencies in their applications. Their numbers didn't make sense. Some of the things they said were not correct. So we had to go back to them and get further clarification. So it is a rule that HISRAP funding that comes from the city's general fund must be spent only on Palo Alto residents. So Blossom Birth does not meet that standard. The lowest minimum grant we can offer is $5,000, and currently they don't serve enough Palo Alto residents to warrant a $5,000 grant. So they asked for 15, and that was yet another problem with their application. They asked for money to serve people who live outside of Palo Alto. Not that their services aren't wonderful, not that their mission isn't admirable, not that we don't support the needs of mothers going through mood disorders following birth, but their application had to be formulated in such a way that it would fit within HISRAP guidelines.
So it was very, just for clarification, it was very close. So
it was close, but it was just under 5,000.
Just under 5,000, so that's
right.
Just
but
this
then
discretionary.
Secondly, HISRAP funding was designed to serve low and extremely low income people. And this demographic that Blossom Birth seeks to serve is a fairly high earning demographic, who makes an average of, I think, $117,000 a year.
What the application said was that I want to say subsidy, but the ability to have a scholarship for the program would be open to women earning up to $117,000.
Right, but they had made no specific mention in their application of what their outreach efforts were to low-income women or low-income families, none. So it was very hard for us to really see how they would fit in well with the HISRAP guidelines as their application was currently written. That isn't to say they couldn't come back to us in the future with a more well-developed program that does better outreach, to one, to Palo Alto, and two, to different income levels within Palo Alto. Because certainly I think their mission is completely out.
Can I add just one thing to it? Just one addition to what you said as far as Blossom Birth. When we asked the specific question of outreach to low-income parents for these specific programs, they said that there are 2 programs through the county that serves that demographic, but they had, as an agency, their focus was serving middle-income individuals. So it wasn't that they hadn't reached out. Their service model, while looking at some, the county has a couple programs that serve low-income parents for postpartum issues. So they had positioned themselves, for lack of better phrasing, that their services were for middle income. So I just wanted to clarify it. It wasn't that they hadn't. It's their service model is to middle-income parents because they that there are 2 programs out there that serve low-income parents for some of these postpartum services.
I want to ask Commissioner Onan to speak to ACS and CASI because, you know, the history, being a new member of the commission, is not entirely clear, but I want to get an understanding as to school-based counseling services and outside of the school-based counseling services, because I think that informed the inquiry of the subcommittee. Certainly was one of the things that added color to the decision-making. And so I wonder if you could just speak to that.
All right. Thank you, Chair. So as I mentioned, ACS is probably the oldest member of the HISRAP family going back to the early 1980s. And at one time, ACS provided on-campus counseling as well as off-campus counseling services. And they particularly ran the LGBTQ plus based program called Outlet. So at that time, I think they were our largest HISRAP grantee for some years, but they changed their relationship with the school district, and the school district now has a different on-campus counseling provider, which is known as CASI, but ACS still serves Palo Alto in the form of its other counseling programs for youth and families, through LGBTQ youth, for the substance abuse program that we heard about. We felt strongly that both ACS and CASI do amazing, wonderful work in the community, and youth well-being is a huge priority for both the city and the HRC. So our goal was really to bump them both up significantly in funding to try to create a sort of umbrella of mental health services for youth, both those who are served by the school district and those families who need other service beyond what the school district offers. CASI, my understanding, offers more of a short-term therapy model. ACS offers a longer-term, ongoing type of therapy model. And families have different needs at different times depending on what their kids are going through. So I think we funded them at an equal level in our initial proposal, which would be more than about $85,000 worth of mental health services for youth, both through the schools and both through ACS. So I feel that is a great step forward. That's not to say more funding couldn't be used. That's not to say all needs will be met, but I think it's a huge step forward from where we were and a great use of those funds for those agencies to continue to work in partnership. And of course, we'll continue our efforts to get the City Council to continue to fund his RAP in increasing amounts because the cost of living is going up and agencies are having a hard time with their staff requirements here in this expensive city of Palo Alto. But for where we are today with this snapshot of the funding we have, this is what I think is probably the best solution we can come up with.
Yeah, I do want to point out a couple things. One is if you combine those two, which had a prior funding level of 46,000, and you look at the current recommendation of 85,000, that's quite an increase from the previous recommendation. The other thing I want to say is I listened to discussion about a commitment to homeless and commitment to providing critical services, food services. And I do want to say that I think Commissioner Lee, in his funding proposal of, I think, Life Moves, he did in fact increase that. So I know that he feels very strongly about the homeless in the community as a second priority, as do we. Any further discussion of the motion that's on the table?
Yeah, so for CASI, if it is part of the on-school campus thing, it probably gets donations from parents with the PTA and PI contributions going towards that. And so does it really depend on the donation from the city, or is it getting funding from PTA, PI as well? Because I haven't heard of any service or anything that is associated with the school that is underfunded. Usually parents are donating generously and...
The school district is not fully funding this program. So the full cost of this program is $759,000. The school district is funding it at a level of $677,000. It's my understanding in their contractual agreement with CASI that CASI is responsible for coming up with the additional funding. Is that correct?
We are not allowed to solicit donations from families.
Okay, so for the additional cost that the school district isn't fully funding, and you can correct me if I'm wrong. So the additional amount that the school district isn't fully funding, they have asked CASI to do so, and they are not able to get donations from individual clients, so they then go through different funding sources in the community or others that fund mental health services to be able to find, to fully fund that program. So at this point, they, other than the amount they're getting from PAUSD and their $50,000 from the city of Palo Alto, they have about another $30,000 in fundraising that they do and about $2,600 in in-kind contributions to the program. Does that answer your question? I don't believe they're getting any money from PI. Is that correct? Partners in Education?
Not for this contract, no.
Not for this contract. So that could be that PI money is going. So this is the middle and high school contract. So CASI also has a contract for the elementary schools. So it could be that PI money is supporting mental health services on the elementary school campuses, but I can't say.
That's helpful.
Okay.
So I'd like to see both ACS and CASI bumped up to 50 each. So I would propose a substitute amendment to bump up those two to 50.
Can I make a second?
Well, I mean, I can make a substitute motion though, right? Because if the motion as is passes, then that's done.
Yeah. To make a substitute.
Is there a second to the substitute motion?
I think as part of this, Commissioner Lee, I think to be able to have folks adequately discuss this, you'd have to say where you would take that money from to fund the additions to those two sources.
So I'm going to defer to
Let me
Commissioner Stinger.
try to find a compromise, as I'm apt to do, between the two really good proposals. And you know I care about the balance in this proposal. But what I was looking at was the request that the agencies gave us for 2020 and the contracted amount that they had in 2019. And I'm wondering if or I would like to propose that, I'd like to make a motion that we.
So this is a second substitute motion?
This is a substitute.
I withdrew my
an
substitute
amendment.
Okay.
Because there was no second.
All right.
So the, I guess, friendly amendment that I'm asking if you will accept would be 50,000 proposed for adolescent counseling services, which is between the contract amount that they had last year, the 100,000 that they requested this year, and is 75,000 more, 7,500 more.
They didn't have $100,000 last year. That was their request.
And then I have the columns mixed up, I'm sorry. I
Okay.
meant to say that their contract last year was for 10,500. Request was for 100,000. And I would make up that difference by taking small amounts from Abilities United, 2,000, Vista Center, 3,000, and YCS, 3,000. And those amounts still increase the contract amount from 2019.
No, I think Abilities
Wait,
United is
we
only.
need a second.
Oh, sorry.
I'll second that motion.
Okay, go
Substitute
ahead,
motion.
please.
No, I strongly disagree with that friendly amendment. Abilities United was only getting a few $1,000s increase, and they urgently need that money for staffing to provide services for adults who need services. And even a small decrease will make that impossible for them to fund those staffing positions. All of the agencies who asked for, Vista has a waiting list that's quite long with seniors who need vision services, which means that fewer people will be seen, which means that fewer people can stay in their homes and live independent lives. So there's a huge impact to that, to even reducing by the small amounts. We came up with the amounts looking at their funding requests to staff certain positions, to offer certain programs. So to simply take them away is actually quite detrimental to the agency. Adolescent counseling services got quadrupled, as our chair said. I know they would like more money. I would like to give them more money if we had it, but I am really satisfied with the $42,500 that we're offering them.
Commissioner Brombaugh. We're talking about the motion made by Chair Stinger.
Yeah, I mean, it seems reasonable. I can go with that.
Okay, Commissioner Shu.
Commissioner Onen mentioned two agencies. I'm going to focus on YCS. I had very good experience with YCS, so thank you very much. My daughter worked with YCS, so I knew this. They provide wonderful opportunity for the youth. So look around. We all grew up from the young age, right? With that kind of service, I feel they provide very high quality opportunity or service to the youth. If we cut their funding, I'm not feeling comfortable. So I just speak for this part. But in conclusion, I'm not supporting the resolution.
I'd just like to ask Commissioner Stinger if she could go down the list based on her new proposal, and identify just one by one so I could have a clear picture. No, just.
So I looked at Abilities United, and my proposal would be 49,739, which is above the contract amount, and is $2,000 less than the agency requested. And Adolescent Counseling Services at 50,000, which is 5 times what they contracted for in 2019 and half of the agency request for this year.
And that's an increase of 7,500.
Over the committees.
Okay. So you're -2 and plus 7.5. Please keep going.
Vista Center, -3.
And that would be at 37?
So that would be between the $27,000, the $137 from 2019 and the 2020 agency request. And then I think I had 2,500 for YCS.
A reduction of 2,500?
I'm sorry, yes.
Okay, so you changed one higher, which is the adolescent counseling services.
Mm-hmm.
And you took 2,000 from Abilities United. You took 3,000 from Vista Center, and you took 2,500 from Youth Community Services. Is that right?
Yes. Does that arithmetic work? I think it does.
I believe that it does. Okay.
And
so
I
that
just
is the
would-
motion on the table.
That's the motion on the table, and I'd like to comment to Commissioner Shu. I agree with you totally, that each of the agencies has a very strong mission, has an important mission in this community, and with the one or two exceptions that I might vote differently on Ada's Cafe, I think they all have good proposals, and they all deserve to be fully funded. So it's not easy.
Just for clarification, I think that's the amendment on the table.
Yeah.
The motion on the table is still the original.
That's right.
So,
And so do we take the vote on the amendment first?
Can we
take the vote on the amendment?
Can we still try to get something to the Blossom Birth?
Well, that would be a new amendment. And
or it could be part of them, if they're willing, to do that.
No, I mean, I'm just requesting to Chair Singer. Because we gave, oh, yeah. I mean, we gave to everybody else. They made the request, we give nothing to them.
Make a motion.
that would be the third.
Or so just to talk out loud on the, are we still discussing the amendment? Can we continue discussing it?
I think Commissioner Brombaut is asking for what is a third amendment.
If we
I
continue.
think she's
okay.
asking to add something, or for
could do
that
a-
group to discuss
We could do
something
a
in
friendly
their
amendment to the
friendly amendment.
So in discussion, if we can find 5,000 to put into Blossom from others, we can consider making that a friendly amendment to all.
So would you like to restate your amendment
Well, I
in
think
a
we
friendly
need,
way?
I think we need to we need to discuss it first. Let's see.
I think the legal assistance, the senior adults legal assistance thing, if they're getting assistance.
I'd be comfortable, reducing that to their 2019 amount. Oh, actually, that doesn't give us much. That gives us, what, $600? But yeah, let's do that.
And just so the public realizes that we cannot hold a meeting with 4 commissioners outside of a public meeting. And so the subcommittee is made up of 3 members. And, this is our chance to try to get the views of others on the work that we did. Unfortunately, we can't do that outside of the public's view.
Yeah.
And so this process is something we anticipated, certainly welcome, and I think most of the ideas have been really well-meaning and, in the good spirit of trying to give money to people that really need it. So I do appreciate the discussion and the civility of it, so.
So maybe from Mayview, we can take from Mayview.
Yes.
And then just keep it simple, like just
Mayview.
take it from Mayview and then
Yeah,
give it.
I would be, okay, so I would say, yeah, reallocate, bring Mayview down to 35. So that's still an increase from their 27.6 from 2019, and it's sort of a midway point to their request. So does Commissioner Singer, would you take that as a friendly amendment to her substitute motion to move 5,000 from Mayview to Blossom Birth?
Before I answer, Commissioner Onan, can you help me by answering a question, the 40,000 that the agency requested?
Which agency?
Mayview. Some of the requests you accepted at full value, and this was one of them.
Yes.
And some of them you felt comfortable taking a midpoint between their. What was the discussion on the 40,000 that they had requested and that you recommended?
So Mayview is the sole provider of physical and mental and dental health services for many low-income people in the community, and they urgently need to expand their facility. They need to pay for a provider, and they need to increase their service model here in Palo Alto. There is no alternative to them for people who live in Palo Alto. So we felt strongly about fully funding them because, again, people who are suffering physical, mental debilities cannot access other services. They also serve many, many pregnant women. They serve young children. They provide vaccinations. So this is just our in the trenches frontline agency for some of our most vulnerable residents.
They do have a combined grant from the HISRAP and CDBG funding.
So CDBG is a one-time build-out to bring their new dental suite, yeah, because again, dental health, research now shows us that people who have poor dental health have poor overall health. So again, they're being very, very on point and on the spot with their mission to improve health for low-income people in Palo Alto.
I do understand that, thank you.
I wondered if you did accept that proposal from Commissioner Brombaut, Commissioner Lee, which is the drop of the Mayview 5,000 to fund Blossom, would all of the grant amounts increase from the previous year from each of the agencies? Is that the case? Could we get?
I believe it does. We didn't reduce anyone else, right? We're just taking it from Mayview.
No, but I'm saying from the previous year, does everything increase?
Yeah, because the committee's recommendation increases everyone, right? And so we are just adjusting Mayview down 5, which is still an increase from their 2019 contract amount. Right, because they got they got
Yes.
27.
YCS is an increase, VISTA is an increase, United.
That's everything else is an increase.
Okay, and I believe that's a statement of the commission on needs.
And that was partly why I went with those numbers.
Did you want to reformulate your proposed amendment according to Commissioner Brombaut and Commissioner Lee?
I'm sorry, I can't.
You can't. You would like them to do it, or?
I think staff could not frame it, but staff could tell you, I mean, what we have written down from what we've heard.
Okay, why don't we go one?
I'm not, I can't
Okay,
accept it.
thank you.
Is there a different
It's,
setup?
I'm very taken by the need for that service, and I'm wanting to fund a new agency, and I want to, there's a lot that I like about the proposal that they submitted, but I'm taken by the argument of the numbers of people they serve, the income level they're addressing.
Okay, so your friendly amendment stands at the present time. And I think we should take a vote on the friendly amendment. All in favor?
Aye.
I'm abstaining.
Okay, no for me?
No.
Okay. All right.
Thank you for entertaining the motion.
Sure, and it was a glorious effort to try to
Spread the pennies around.
bring us together on what we all believe should be funded. So, so the motion on the table, I think that we have the motion and the second, is the motion to accept the subcommittee proposal as drafted and presented tonight. All in favor?
Aye.
Aye. Okay, we have 5 ayes,
I'm not in favor.
not in favor, so 5 to 1. Okay, that completes item number 2. I'll take a deep breath. That's part of the. Yeah, I do want to salute Commissioner Lee, who really took a careful look at that. Thank you. So we have commissioner reports. I'd like to begin with Commissioner Lee.
Sure, it's been a pretty busy week. So Monday, Commissioner Singer and I hosted our LGBTQ plus working summit. Thank you to the chair for attending. There were a lot of great ideas brought up during the...
We're going to need a little bit of quiet to get the record. If the members of the public could please come to another area. Just have to ask for order. Just take a minute to clear the discussion outside the room, please. I do want to say thank you again for attending and putting the effort in to all the proposals. Also want to salute staff and all the efforts that they've made. Okay, we're going to turn to Commissioner reports. Commissioner Lee?
Yes, it's been a pretty busy 2 weeks. On Monday, Commissioner Singer and I hosted the LGBTQ Working Summit. Special thanks to the chair for making an appearance. There were a lot of great ideas and great energy presented at the summit, some which this body hadn't considered. There were some surprises, good surprises, but some good reaffirmations of some things that we observed from the listening forum and from the survey. There was a lot of great energy that sort of carried us through the end, and hopefully we can keep that momentum going and really just facilitate these agencies working together. And there were quite a few ideas of things that they would like the city to do. Things like, we'll do a full debrief at the next meeting, but things like making sure all of our forums are, gender inclusive, or just making sure that the tone from the top of city management was set such that city employees feel more comfortable with their particular identities and such, because there at least were a couple of folks who had expressed that there could be a stronger, more visible support. Not that it was hostile, but there could be more support from city management for city employees. Related to that, yesterday, Fletcher Middle School, their PTA hosted a ABCs on LGBTQ youth, which was very, very great. I was able to attend that. Did we do anything? Did we have something last week?
Yeah, we did.
Are you being facetious? The gender equity event.
Oh, yes. I knew. Okay, yes, I knew. It's been we had I went to the gender equity event.
And I shouldn't say that, because Mary and I, they were both at the Art Center, and they go, "Is this one the LGBT or the gender equity?" We were getting totally confused.
So that was a great event. I did mostly listening, given the topic. Nothing really surprised me, but it really deepened my appreciation for the need for additional work on that front, and how so many things in our community, how so many issues are interconnected, in terms of mental health, the always-on culture in Silicon Valley, and how all of those sort of play into and reinforce each other as it respects to gender equity and other issues. Those are all that I can think of at the moment, so I'll defer to.
Thank you. That's a lot of hard work. Commissioner Stinger.
I'd like to just comment a little bit more on the gender equity. There's a lot more to say about the summit that we did, but we did say that we would come back in April on that. And I think there's a lot of good work to be done and a lot of lessons learned about the summit. But I want to talk now about the gender equity event that we did, because that was the first of the Building Community One Conversation at a Time series. We had about...
It's a fantastic venue. It's a venue that just, all the participants felt safe to express themselves. And I think both you and Commissioner Lee did a great job. Also Commissioner Coloma Smith, who did work on the gender equity and helped to secure the wonderful speaker. But it is a wonderful venue to hold these conversations.
They are a really supportive venue. They're really helpful, and it does work really nicely for something formal, for a range of informality to formality. The takeaways that I had from that meeting were that I think the format was good. The speaker was casual. She talked a little bit about her experience. She had a few data points, but she was mostly just opening herself up to questioning. And I think that was it wasn't what I would have expected from the speaker, but it worked well, and it sort of triggered conversation at the individual tables. So I think it's a format we can learn from. A couple people talked to me about a repeat schedule, and I think we need to think about that in our annual planning. How often we want to repeat that so people know that once a quarter, or the end of the fourth Thursday, the second Thursday, whatever it is, that's where they're going to be, because they did come up and say, when are we coming back? And we want to respect that. One of the other lessons was, and it's fairly obvious, that PR is so important. We just ran out of, we kind of hit a capacity limit for this, but really it's the personal invites that make all the difference, and to have each of the commissioners use their distribution lists and do the one-on-one contacts would be really helpful. And I think that's all I want to say about that. But I do have some other things to share. I'm going to pass around some things from Mountain View. Their leadership class is going to do a day in Mountain View. And they're going to post pictures on sentences from the homeless community. One day on where I rest, what I eat, what I enjoy, where I learn, when I grow up, to give more visibility to the homeless situation, to the homeless personalities and people, make them real, give a personality.
So
Maybe.
We can scan these if you want and send them out to the whole group, but if you don't want to lose these.
No, if you could take them, that'd be great.
Okay.
City of Mountain View is also doing a multicultural festival on Saturday, March 30th from 11 to 2. You'll be seeing that come around. And then we talked about this before. Their Civility Roundtable on April 6th is going to be on conversations about important. I want to use their title. They're talking about living in RVs, and they are using the League of Women Voters civility model, which so it'll probably be two things: a format on civil conversation, and then the content also. If I can keep going just really quickly. I think I probably have enough of these that we don't need to copy. But our Avenidas is starting a culture club, and they will have a spring party on March 23rd, which is next week. And then the last thing I want to mention is that I went to the county's HRC meeting last night at Santa Clara. And what was interesting was I think we are probably the last commission in the county that still is a Human Relations Commission.
Right. The county just changed it as of January 1st.
And many of the cities are also. And I made an argument that I really like human relations, because I think from all of our work in implicit bias, we know that regardless of what the law says, it's still about how people relate to each other. that's as equally important. So I said, maybe we could be the Human Rights and Relations Commission, but I'm not ready to give up personal relationships yet. The county has, and many of the cities have also. And one of the content things that came out of that meeting was well, first of all, there were just, besides all the commissions, they had numerous service organizations, and everybody was just sort of looking at each other. Really, I mean, there was just so many different agencies that we weren't aware of, and that was really impressive. The other piece that came out of it was that the county might be able to do some work on things that really belong at a county level, human rights being one. Each city can't, it's hard for individual cities to put that effort into becoming a human rights city, but we could become a human rights county, and each city could cooperate with that, and it would make the work, would facilitate the work, but the other piece of it is it would also facilitate a reasonable content. You don't want to be in, and we came across this when we were looking at immigrant rights. You don't want to step over the border and find out Mountain View has a different set of rules. It really needs to be consistent throughout the county. So that was one of the things that they were going to take a look at, is how we could work together on what initiatives and how we could cooperate. So it was an interesting meeting.
I appreciate your leadership. Thank you for attending. Commissioner Brumbaugh. And let me just say, each of us here has put in a lot of work on these proposals tonight. I want to thank everyone for that kind of effort. It's extensive.
Yeah, I mean, and, you know, whatever the discussion, it was not, and, I totally was deferring to the subcommittee, but I just wanted to have a discussion and make sure that we were doing the right thing by, especially.
Thank you for saying that.
Yeah, so, yeah, I appreciate all the hard work. So, I mean, I did have one comment. So I was here in the last meeting when we had the election. And then February, I couldn't attend the monthly meeting. And so this is the first meeting after the election. And I wanted to make a comment that I was not happy with the HRC process of electing the chair and the vice chair. There were 7 people, 4 people who were the majority got to select who they wanted to be the chair as well as the vice chair. Because everybody voted again. So 3 people voted one way. They wanted a different chair and a different vice chair, and 4 people were in the majority, and the 4 people got both the positions. And so we are a diversity and inclusion with human relations and there should be thought given to the way the chair and the vice chair are elected. If the chair is elected, after that, whoever was second in the first election should automatically become the vice chair.
I'll take that under advisement. The process that we follow is in the handbook, and I could pass that on to the clerk's office as they make considerations for possibly updating the handbooks for the commissions.
Yeah, because it seems like the minority people on this commission are not getting the right representation.
Okay, I will pass it on to the clerk's office.
Okay.
Is there anything that would help that? I mean, in terms of your
I want to be
activities?
careful of not just starting to discuss it if
just-
it's not agendized, but.
Right. I mean, when you say, is it just the vote, or is it, you said that they're underrepresented, meaning?
Or vice chair is Chinese.
No. Practically speaking, I mean, what would that?
No, I mean, I'm not saying minority as in
asking.
the race. There were 3 people who wanted to vote one way and 4 people who wanted to vote the other way. The 4 people got to select both the positions, the chair and the vice chair.
Okay, I'm going to second your thought process so we can discuss that and agendize it, all right?
I don't think I'd have to check if it's up to discuss her thoughts or discuss a change to it, because I don't know if this commission on its own has the ability to change the process. I'd have to look into that.
Well, I think I'd like to agendize whether someone could advise us about whether we could make changes to it.
Okay, well, you can talk about that during agenda planning.
That I can second?
Yeah, sure.
Okay,
I mean,
I'd
that
like to
is
second
something which felt wrong to me as a process, as to the process that we followed. There are a lot of wrong processes in
that we're
this.
not discussing it, folks.
Yeah, what we want to do is
I'm not
just
going to
second
discuss it, but I'm going to say that nothing in the prohibits the commission from making those adjustments, and that's all I'm
All
saying.
right, so why don't we do this?
And you're reading of the code.
Let's second that topic and agendize it for next time. Anything else?
No, I mean, that was the thing, you know, I appreciate all the work everyone is doing, and we all have the right attitude and the right values. You know, there is that emotion where we all want to help people, and that is what is binding us. So, you know, I don't want it to be taken, you know, one way
Well,
or
of
the
course
other.
not. I mean, a
Yeah.
tremendous group of people showed up, and really, they're doing wonderful work.
And I wish we had 717, you know, K, and, you know, everybody should be, you know, given what they requested.
I think, I was going to say yes if we had it, but I think if we had that much,
There'd be more requests.
there'd be more requests.
Oh, yeah, I didn't get it last year, but
Don't let the word out. Okay, great. Well, thank you again. Commissioner Onan.
Thank you. So most of my extracurricular work, of course, was reviewing his rep applications and then meeting with my esteemed colleagues here for several hours. But we did have the benefit of great sandwiches that were provided by Mary and Minka. Thank you so much for that. In addition, I heard from Barbara Klausner, who was the outgoing ED of Dreamcatchers, to say goodbye. And of course, we met the new ED tonight. And then coincidentally, one of my graduate students at Stanford is pursuing a doctorate in education, and she is a math teacher of Hispanic heritage and was very interested in learning about Dreamcatchers and may do a research project there to finally get some metrics on outcomes of their program, which would be awesome, yeah. So I was so glad that my two worlds of my professional teaching life and my volunteer commissioner life kind of intersected there for a moment, and something great might come out of it.
Commissioner Shu.
Only one small activities, you know, the Lunar New Year celebrated party. I went there, so I ran into Commissioner Lee. So it's a wonderful opportunity. When I look around, it's a little bit small than what I expected. So I don't know what we could do to make a bigger promotion to attract more people participate in those kind of activity. Well, you know, one thing I was a little bit surprised, you know, it's very short programs, right? So I guess, you know, it takes a lot of effort to organize those kind of things. So by saying that, you know, I really enjoy those kind of activity that shows the cultural diversity. You know, beside that kind of Lunar New Year's activity, I participate different settings through a church and some other activities, like I mentioned, Commissioner Lee. You know, the activity our church organizes attract more than 3,000 people. So basically, you know, you know, different group of people. There's a whole Bay Area. So it really depends how much effort, how much you know, manpower, resource we can put in. So we can make a major impact if we do the right thing. So that's what I want to say. Yeah.
Chair Kralik, after you do your report, can I add 3 things real quick? After you.
Why don't you go ahead?
Okay, great. Sorry, I totally forgot about these things. So I attended Aveneza's opening this past weekend. I thought the space was fantastic, very open, very peaceful, so I thought that was great. I had a chance to attend the Palo Alto Mediation Program's last meeting, and I was very encouraged that they decided to take diversity to heart. They are focusing this year on doing greater outreach to the community to make sure that they actually get more folks using their service and more folks know about them. So they've decided to forego doing recruitment this year, and they would do it next year after they've expanded their outreach efforts. And hopefully, when they do recruit, I guess 2 years from now, hopefully that group is a bit more reflective of the community. The only other thing that I would say is I did attend the Lunar New Year event as well as the Chinese New Year event hosted by, it was the Chinese Parents Club, or it was to raise money for PAUSD. I thought both events were very great. One positive, constructive feedback I would give to the city, though, for the Lunar New Year event, the performers themselves were not quite reflective of the community that the event was designed to celebrate. And so it felt somewhat optically odd. And so if that's something that they, again, it's a positive feedback that I'm trying to give here, if they can just be more sensitive to the optics of it. You know, as a Chinese American, it was sort of weird seeing very few Chinese Americans actually represented in some of these smaller performances. I mean, they were certainly there in the big group performances, but some of the 1 or 2 or 3 or 4 people performances, it seemed optically kind of weird for me. Not that it should be homogenous. Yeah, not that it should be homogenous, but it should be more reflective of the community that it's designed to sort of celebrate. So that's my feedback.
I have you all beat. I attended 4 Chinese New Year celebrations. My son was a lion dancer. My daughter was a Chinese dance troupe dancer, and they did a fabulous job. And I think Commissioner Hsu had it right. There are so many of these celebrations out there for the Lunar New Year, not just Chinese New Year, that you know, it's hard to recognize all of them and the efforts that are made, but I think it is a wonderful demonstration of our culture and our wonderful community of welcome. I did attend 2 very important presentations, one on gender equity, and I sat with the speaker from Stanford who gave a wonderful talk and a story about her father. And, you know, I think when I read the news that the soccer team had sued with my daughter on a Palo Alto soccer team, I felt that, you know, we're all in this fight, and I think it's wonderful that you know, we can kind of voice these concerns. And I think one of the things in terms of human relations is really getting people together. And I really liked that presentation because people talked openly, respectfully. They had different points of view, but they felt safe to do it. That is a wonderful venue. I will say that when I attended the LGBTQ workshop or summit, that the firepower that was in that room in terms of people who are members of our services and communities and their focus on trying to protect youth, which was one of the things that we identified tonight, was just upfront. And there is a real consensus there that we need to be protective and careful and value people as individuals, and that was wonderful to get from that. And I hope we do follow it up with the recommendations to council. And I know Commissioner Lee and Commissioner Stinger are working on that from the input. I have had discussions with, I am a liaison to the mediation group. I was a mediator, part of that group. Not only did Commissioner Lee visit with them, but so did Commissioner Smith. Both were welcomed. Both discussed openly this issue of you know, having a representative group or reaching representative groups within our community. And that group is really committed to it. And they're really great people. They're volunteers. And they appreciated your attendance. So thank you for doing that, spending that extra time. We'll move to any other council liaison reports that want to be given. I think we sort of covered them. So we'll move to the staff liaison report.
I only had one thing as a reminder, if people have suggestions for the scope of services for program administration of the mediation program. I believe those are due Tuesday. And the other item I will bring up during agenda planning.
Can I ask staff a question? I wanted to know, has there been any update to some of the recommendations that council had considered back in October from city management in terms of just an update on those items?
If I can go visually down it, the letters have gone to the folks in Sacramento. The Amnesty International, that was, you know, passed that night. CDOT, it looks like policy and services is quite busy, so when I checked last, it looked like that was going to be after the council break.
So in fall?
Yeah.
Okay.
And if folks can help me remember what the last one
I
was.
think there was SB 54 and 31.
Those are the letters, those have gone. The, as far as those,
okay.
those updates, I did check. To be honest, it's been about a month since I checked with the city manager's office about those two. So I'll put that on my to-do list again.
So I think there was two components. There was a letter and also just having them confirm that policies, procedures, and programs.
That's the one that I checked on a while back that I'll put on my to-do list again.
Sorry.
No, that's perfectly fine because I couldn't think of them all in my head.
Okay.
Yeah, so I will check on that.
Thank you very much. Agenda, are we on tentative agenda?
Are we through the staff report?
Yes,
I thought
because
there was
my
an item
other
that-
item was an agenda item for April that I wanted to bring
So
up.
you'd like to cover that under agenda?
I would, thank you.
Okay, wonderful. All right, well, tentative agenda items for the next regular meeting. Let me just say that we did have that motion, not a motion, but a second to the discussion of Commissioner Brombaugh.
Okay, so,
And I'll add a third to that in case that helps.
right, so, yeah, so with anything, then it will get on the agenda. I can't promise it'll be on the next, so just for folks to remember, when things get a second, that means it does get on the agenda, but that there's not always the ability to say, I promise it will be on the next agenda. That's a conversation with leadership, so. But that doesn't mean it won't be. I just want to be honest about that. So we have the someone from Avenida. So the leadership team talked about doing another learning series, and very interested on transportation in the community and how that looks for different vulnerable groups. So Avenidas will have their two transportation folks coming to speak to us at the next meeting. I know we're going to invite folks from the city shuttle program. If there's other aspects of that you want to shoot me an email to other aspects of vulnerable communities, I would assume that the conversation with the city on the free shuttle program would include transportation for low-income seniors also, and homeless folks, because it's a free shuttle program. So, but if people have suggestions, I'm always willing to listen.
I was just going to say that I really like that idea, so thank you for
Okay.
bringing that. And it sort of relates to one of the councilors for priorities for the year, like transportation and traffic. And to the extent that the other three council priorities have an intersection with HRC jurisdiction or issues or vulnerable communities, it would be great if we could have folks come and do presentations to give us ideas of how we can help the council weigh in on their priorities through the prism of what the HRC does.
Okay. Then the other item that I have for the next agenda, so folks may remember that have been around a while, that we have an emerging emergency need fund that is $50,000 a year that the council allocates. It doesn't compound if we don't spend it, so it's $50,000. If we don't spend it all, the excess goes back to the general fund. It's reallocated. So we've been doing that for a little over 2 years. I crafted that policy and I brought it to here, and it was recrafted and accepted, and then it went on to council to be accepted. I really feel like after 2 years, I'd like to look at that again. So what I'd like to do is send that policy out to the HRC to have you look at it, provide me some suggestions to craft an initial policy for the full HRC to look at the next meeting. I'm looking specifically at Commissioner Onan, Commissioner Lee, and Commissioner Smith, because those, to the best of my recollection, are the three commissioners that are still on the commission that have been on one of those subcommittees, some committees, and have lived through the working out of that policy and may have some lived experience to say, hey, that worked or that won't. So
Could we form a ad hoc committee?
I'd prefer to do this the same way that I did with the other two policies, so to have some consistency. But I commit that the meeting next time will be a full version of being able to review that.
And do we need to make a recommendation by the end of that meeting? Or is
What
there...
I'd like to do, I'd really like to do that for the reason that it may need to go back to council. So what it's changed to, my supervisor would like to look to. If it's something significantly different that has been done before, then she feels, and I would agree, that it would need to go back to council. I'd love to get it on the consent calendar for council and have it operational by July 1st. So when that we send out the next announcements for folks to be able to apply, it will already be ready.
Okay, July 1st
so,
is, okay.
So, like I said, I commit to listening to all suggestions, and I commit to having a full discussion about this at the next meeting.
Great.
So who is your manager now?
Who is my?
Your manager now.
Oh, Monique is my manager.
Okay, okay.
Yeah, so I report to Monique.
Okay.
Yeah, I used to report to
Do you
someone
need a
else.
second for that proposal?
Not as staff, no.
Okay, you're in charge. Okay. All right.
One other...
But,
Sorry, go ahead.
yeah, go ahead. And then I had one more thing, but is there a question about
No,
this?
no,
Yeah.
not a question.
And then I would like to, because I thought it worked really well last year, is I would like to suggest again, and that we agendize it for next time, the June, a retreat in June. For years and years, we had it in August. And I really felt it worked nicely in June because if there are new members, then they are included right away in the forming of the vision for the HRC. And it gives us the summer to be able to have some of the ideas percolate and get ready in the fall, ready to go. In the past, when we've had it in August, it's like September and October and sometimes November. We're still like, you know, the HRC is still going back and forth, like, do we want to go with proposal A or proposal B? And I think having it in June and maybe some discussion over the summer really puts the HRC in a good spot in the fall to work on its action plan for the next year. So my suggestion would be that we have the retreat again in June before people go off to vacations, and that we, if you feel necessary, agendize it for the April meeting.
And you don't need the second, so I guess you're going to go right ahead and do that.
Yeah.
No, you can weigh in.
Great, yeah, let's
No,
let's
I
move
mean,
forward.
you can when we meet as leadership, I mean, we can discuss if that's not an interest of folks to have it in June.
I don't have a comment on that. I think June's fine.
Your term ends at the end of May. Yes. So there's 2 terms ending, Commissioner Nance and Commissioner Brumlutz.
And I think they just extended the deadline for applications, right?
I think I saw it was April 2nd for anybody that wanted to apply or reapply. Yes.
I had a couple of things that I wanted to suggest for future agendas. The first one is, I think, is SB 1421, the Palo Alto Daily. I believe it was a daily. They wrote an article about SB 1421 is a law that took effect January.
It's the letter
1.
that I sent out.
It's a letter that got sent out, and I think there would be interest from the community to have to give the police chief an opportunity to come and give a presentation about it and to solicit public comment on it. I think now that it's been written about, and there seems to be a 60-40 split in terms of what cities are doing on it. I just love to give the community an opportunity to give their thoughts on it and give the chief an opportunity to maybe reiterate in more detail some of the things he mentioned in his letter. I think with the aim of fostering even better police-community relationships, I think that sort of opportunity would only help foster that very strong relationship.
I'd like to second that. I think, one of the things, like when someone writes you a letter with your name on it, it's just like, what would you like me to do? But the thing that he was saying in his letter is that he's made a decision, an interim decision, to withhold 2 files that qualify, depending on how courts view the date of the effective date of this particular law. And so he's made a decision, and he's argued that it's consistent with other decisions, and it's protective of interests, which is great. But I think he's made a decision, and I think timeliness is important for us as a group to talk to him and to have him present.
Mm-hmm.
I'd really like to have him come.
I know the next meeting is really packed, but if we are
Still,
able to squeeze it in.
Yeah, I'd really like that.
And then the other 2 things are sort of, I guess, questions to staff. So I know at the last meeting, there was discussion about needing to revamp the, how the commission may recognize groups, how we might endorse events. I'm wondering if there was a sense of when that might appear on the agenda. Do you happen to know, at the last meeting, we talked about needing to revamp the process in which the commission could do recognitions of groups, individuals, or how we might endorse events. And so I'm wondering if you had a sense of when that might come to the commission.
What I'd like to do is, agendize something that would be a discussion of the process and ask for volunteers as an agenda item. I don't know if you would second that. But, my thought process, having lived through this experience with 3 commissioners and then a 4th commissioner, and my mind's going wild with all these, have we talked to this person and that, is to have one person write this policy and then present it. So, it could be 1 or it could be 2, but I just, I think here's the thing is that I want us to robustly recognize good work in our community. I mean, if we wrote a resolution about everyone in this room tonight, I think we could get consensus on that. But the point is to really to be robust, but to be fair. And so there has to be a process because we don't want to be exclusive of one group or not include another. And we want to be sure that we do it right. Some of the things that happened the last time, because I was new, is I spoke to staff about it, and one of the things that happened is it was a question of, okay, if we make this recognition or this resolution, I mean, what about all the other, I think the resolution had to do with the Lunar New Year. What about all the other people out there that put on a Lunar New Year event? And we might recognize one. And so there has to be a process where we can be perceived as fair, not unfair, but robustly supportive of good efforts in the community. So I do think there should be a process. I don't know that we were going to do it in this next meeting. I think we were going to wait until the following meeting.
May?
In the May meeting.
Okay.
And the reason, there's a couple of reasons for that. One is there might be 2 new members. The second reason is that there's quite a agenda already for the April meeting. And so my plan was to try to call for a single volunteer to craft the policy and present it, working with staff.
So I'd be happy to volunteer for that because I sort of created the work on that. So
But let's have a discussion on it. And
did you want to have a discussion before we have a volunteer work on it?
That's right, yeah. In other words, to ask for, because there's a member that's not present that has expressed an interest to me in working on that particular policy. And I know Commissioner Stinger is also
Now I have a question, actually.
Sure.
So are we talking about recognition of good work or co-sponsorship of programs?
My thought that it would be inclusive of requests from the public and requests from commissioners to, for resolutions, for endorsements of events for folks that come to us and like, for instance, when the Amnesty International. So my hope is it's inclusive of any request to the HRC for endorsement, a resolution, and so forth.
So, just to go through the practicality of it, right? If you had, after the process is in place, right? If you have one commission member working with staff to review and receive these requests, whether they're from one of the others of us, then when we hold a meeting to agendize that item, we've got two commissioners in the leadership who are going to meet. So if we add more than that, then we're going to end up with 4 people, and that's not going to work out. So, my focus was to appoint somebody to, based on interest and discussion, to write it, and the second thing was to appoint somebody to run it. And there was one commissioner, Commissioner Smith, who I've spoken to about this, who's expressed interest in working on this.
So I want to be conscious that we're getting pretty close to discussing the item. So I think the question on the table is that it sounds like there's a proposal to put it on the May agenda, and that proposal at the May agenda would be to talk about the process, about the people that would be involved in crafting the draft policy. Is that correct, Chair?
To appoint somebody to craft it and present it.
Yeah, so, again,
And it probably would be one person, because you're going to end up bringing it to the leadership as an agenda item, and we would review it. That would be 3 people. So.
okay, so we're going to
gonna be
discuss the ideas, not just the idea of having someone do it, but the actual idea.
Yeah, we will,
Okay.
sure.
So that's what I didn't understand. I thought we were talking about choosing someone at May, and then it'd come back in June, and.
Well, they
it's-
would, once they
well,
draft it.
but they've actually gotten input in May from the commission.
That's right.
Okay, that's fine. The other question
Good
I
idea.
had, the other question I had, and maybe this is to my fellow commissioner, to my right, and to staff, in terms of the anti-arbitrary discrimination ordinance update. Just wondering if staff has had a chance to look at that and had a sense of when it might be ready for prime time, so to speak.
That did not receive a second, so I have not done any work on that.
Okay, I thought you were just personally interested in.
I was
so you were gonna-
personally interested, but I have not done any work on it. I have not had
Gotcha.
the opportunity with my workload to be able to do so. In theory, I was interested in it personally, but I didn't specifically to say I was going to do it.
Gotcha.
outside.
So I'll go back to our committee and we'll talk about it.
That would be great.
Great, thank you. And that's it.
My request would be an update from, on the summit that we had in earlier this week.
I would second that.
Did we also want to talk about the community conversation, either the one that just happened or what the next one should be?
I would second that too.
Did we want it?
Like at 7 items, so we're going to have some chatting
Okay.
to do. Just like Dominic, my kid is texting me going, when are you coming home, Mommy? I don't want to go to sleep till you come home.
Is there any other person that wants to address agenda items for the next regular meeting? I think we've hit on most of them. Anything that you have? Okay, I'm going to go ahead and adjourn. It's about 10 minutes to 11. Thank you all.